Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good morning.
Yeah, good morning, everyone. So, a warm welcome to all respected guests, respected lecturers, valued speaker, fellow students, and viewers joining us via Facebook Live.
Welcome to the 20th Undergraduate Colloquium on Health Sciences 2026 or UCHS 2026, focusing on the theme of empowering research, elevating care. We are truly honored to have you, ladies and gentlemen, to joining us today. This colloquium is proudly organized by the Faculty of Health Sciences, University Selangor. My name is Rostina Baharudin.
I'm Kanan Majunar. We will be your MC for today's program. First of all, we will like to extend our heartfelt welcome our respected guest, Associate Professor Dr. Fredlina Zahir, Deputy Vice Chancellor, Academic Research UNICEF, Mr. Muhammad Sharik Dali Mahat, Dean of the Faculty of Health Sciences, UNICEF, Our invited speakers, Dr. Eliza Ahmad, Deputy Head of Department, Faculty of Medicine and Health Sciences, University Science Islam Malaysia. And Mr. Kawiharso Analaki Pungawanam, Operation Head Economic Train Person, Halam Ijau, Integrasi Malaysia Sdn Bhd, esteemed lecturers, staff, and students as well. Okay, ladies and gentlemen, please try for singing Negaraku, followed by the Selangor anthem.
Please be seated. To begin our program, we would like to invite Encik Muhammad Firdaus bin Abu Bakar for doa recital.
Furqan Al-Fatihah. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Ar-Rahmanirrahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين اللهم صل على سيدنا محمد طب القلوب ودوائها وأبدال وشفائها والنور الأبصار وديائها وعلى آله وصحبه وبارك وسلم. Ya Allah, ya Tuhan kami memanjatkan setinggi-tinggi kesyukuran kehadrat-Mu, ya Allah, kerana dengan limpah kurnia dan izin-Mu, dapat kami berhimpun dalam majlis 20th Undergraduate Colloquium on Health Science 2026 pada hari yang penuh keberkatan ini. Ya Allah, kurniakanlah keberkatan kepada majlis ini. Berkatilah setiap ilmu yang dikongsi. Lapangkanlah dada kami untuk memahami dan terangilah hati kami dengan cahaya ilmu yang bermanfaat di dunia dan di akhirat. Ya Allah, kami memohon agar Engkau mengurniakan kesihatan, kekuatan dan kebijaksanaan kepada para penceramah, para pensyarah, para pelajar serta semua yang terlibat dalam menjayakan majlis ini. Jadikanlah usaha ini sebagai satu ibadah dan sumbangan yang bermakna kepada kesejahteraan, kesihatan dan kemanusiaan sejagat. Ya Allah, peliharalah kami daripada sebarang kesilapan, permudahkanlah segala urusan harian kami, dan kurniakanlah kami kejayaan dalam pembelajaran, penyelidikan, serta kerjaya kami pada masa hadapan. Ya Allah, kami akhiri doa kami dengan harapan agar majlis ini berjalan dengan lancar, penuh adab, hikmah, dan keberkatan, serta mendapat keridaan-Mu. ربنا تقبلنا منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم اللهم افتح علينا حكمتك وانشر علينا من خزائن رحمتك يا أرحم الراحمين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي رب يسر ولا تعسر يا كريم رب يسر ولا تعسر يا كريم رب يسر ولا تعسر يا كريم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وبارك وسلم والحمد لله رب العالمين تقبل الله منكم.
Amin, amin, amin ya Rabbal Alamin. Thank you, Encik Muhammad Firdaus. To officially begin our program, we would like to invite Puan Salsiawati Hadir, the Program Director of the 20th Undergraduate Colloquium on Health Sciences, to deliver the welcoming address.
Thank you, MC. Assalamualaikum warahmatullahi wabarakatuh and a very good day to everyone. It is with great pleasure and heartfelt gratitude that I welcome you to the 20th Undergraduate Colloquium on Health Sciences, UCHS University Selangor. I thank the Almighty for granting us the opportunity to successfully organize this meaningful academic platform, which continues to nurture undergraduate, research, and scholarly engagement. I would like to extend my sincere appreciation to Associate Professor Dr. Magela Nalapan Maniam, who has been an instrumental figure as our program advisor, as well as Dr. Muhammad Nazif Samad Elias Drawi and Saiman Afif bin Roslan for their invaluable guidance, commitment, and continuous support throughout the planning and execution of this colloquium. I also wish to acknowledge all dedicated lecturers and organizing committee members whose unwavering support and commitment have made this colloquium possible. This colloquium continues to serve as an important platform for final year students to present their research findings, strengthen their scientific communication skills, and gain valuable exposure to academic event management. The theme for this year's colloquium, Empowering Research, Elevating Care, reflects the crucial role of research in strengthening healthcare practices and improving patient outcomes. In an evolving healthcare landscape marked by emerging disease, rapid technological advancements, and increasingly public health challenges, research serves as the foundation for evidence-based care, innovation, and sustainable health solutions. This term underscores our collective responsibility to translate scientific inquiry into meaningful impact for individuals, community, and healthcare system. To our student presenters, this colloquium marks an important milestone in your academic journey. Your research efforts represent not only academic fulfillment, but also your contribution in advancing knowledge and improving the quality of care. I encourage you to engage actively, embrace constructive feedback, and view this platform as a stepping stone towards lifelong learning and professional growth. Finally, I extend my deepest appreciation to our invited speakers, evaluators, sponsors, and participants for your invaluable contribution and continued support. I sincerely hope that this colloquium fosters meaningful discussion, strengthens collaboration, and inspires continued excellence in health sciences research. May the 20th UCSH be a rewarding and enriching experience for all as we continue to empower research and elevate care for a healthier future. Thank you.
Thank you, Puan Salsiawati Hadir, for the warm and welcoming address. Now, we are privileged to invite Associate Professor Dr. Fridelina Jahi, Deputy Vice Chancellor, Academic and Research, to deliver her officiating speech.
Okay, can you hear me clearly? Okay, thank you so much, Ms. Chairperson. Okay, Alhamdulillah Rabbil Alamin wassalatu wassalamu ala syafil anbiya wa mursalin wa ala alihi wa sahbihi ajma'in. Okay, Assalamualaikum warahmatullahi wabarakatuh and very good morning to everyone. Yang berbahagia Dr. Aliza Ahmad from University Sains Islam Malaysia. Yang berbahagia Mr. Kaviarazu Ponggavanam from Alam Hijau Integrasi Malaysia Sdn Berhad. The Honorable Dean, Encik Muhammad Syahrir Dali bin Mahad. The Deputy Deans of Faculty of Health Sciences, Encik Jamia, Dr. Muhammad Nazir dan Dr. Nur Rasidi. The 20th UCHS Program Advisor, Associate Professor Dr. Meghala Nalapan Maniam. The Program Director of 20th UCHS, Madam Salsiawati Hadir. Distinguished guests, respected colleagues, dedicated faculty members, beloved students, and the organizing committee of this 20th Undergraduate Colloquium on Health Sciences. Alhamdulillah, thank you Allah, with His blessing and love, we are able to gather here today to witness this knowledge sharing session in this 20th Undergraduate Colloquium on Health Sciences UCHS 2026. It is indeed a great honor and pleasure for me to officiate this 20th Undergraduate Colloquium on Health Sciences 2026, organized by the Faculty of Health Sciences, University Selangor. First and foremost, I would like to extend my warmest congratulations to the faculty, the lecturers, and especially the students for successfully sustaining this colloquium for 2 decades. Reaching the 20th edition, it is exactly not a small achievement. It reflects consistency, academic commitment, and a strong research culture that University Selangor is proud to uphold. The chosen tagline, Empowering Research, Elevating Care, captures the very essence of higher education in health sciences today. In an era where healthcare challenges are increasingly complex, which ranging from emerging disease and occupational hazard to sustainability and population health, research is no longer optional. It is the foundation upon which safe, ethical, and effective care is built. The tagline also strongly resonates with UNICEF's strategic plan, which emphasizes quality education, impactful research, graduate employability, and community engagement. Through initiatives such as this colloquium, UNICEF continues to strengthen a research-informed teaching ecosystem that prepares students to meet real-world health challenges. What is particularly commendable about this colloquium is that it is places undergraduate students at the center of scholarly engagement. And I believe through this platform, our students are trained not only to conduct research, but also to communicate scientific finding clearly, responsibly, and confidently. These competencies are crucial in producing graduates who are industry ready, research informed, and socially responsible. Ladies and gentlemen, I am pleased to note that this colloquium is embedded within the Scientific Communication course, MLS 3243, which demonstrating how curriculum-based activities can be transformed into impactful academic experiences. This approach aligns strongly with University Selangor aspiration to produce graduate sorry to produce graduates who are holistic, competent, and capable of contributing meaningfully to national and global health agendas. I also like to acknowledge our distinguished invited speakers whose expertise reaches, research, professional practice, and real-world impact. Your presence today provides invaluable exposure for our students and reinforces the importance of lifelong learning and interdisciplinary collaboration in health sciences. And to our student, I urge you to make the most of this opportunity. Engage actively. Okay? Please engage actively, present with confidence, and receive feedback with openness. Let this colloquium be a stepping stone in your journey towards becoming health professional, researchers, innovators, and leaders who will shape the future of healthcare in Malaysia and beyond. Before I conclude, I would like to record my appreciation to the organizing committee for their dedication and teamwork in ensuring the success of this event. Your efforts exemplify the values of professionalism, leadership, accountability that we strive to instill in our students. And with that, it is my great honor to officially officiate this program. And with the word Bismillahirrahmanirrahim, I hereby declare the 20th Undergraduate Colloquium of Health Sciences 2026 UHS 2026 is officially open. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Prof, for the officiating address and for your invaluable support of this colloquium. Ladies and gentlemen, please enjoy the multimedia presentation of the Undergraduate Colloquium on Health Sciences.
Okay, for the online participant, encouraged to post your question in the comment section. So now it's our pleasure to invite our first keynote speaker, Dr. Aliza Ahmad, Deputy Head of Department Faculty of Medicine and Health Sciences, USIM, to deliver a talk entitled Scientific Perspective on Breast Cancer from Pathology to Practice. The floor is yours, Dr. Aliza. Thank you.
Introduction. Assalamualaikum warahmatullahi wabarakatuh and a very good morning everyone. So I had to thank Associate Professor Dr. Meghala and team as well as UNICEF for this opportunity to invite me as a speaker for today's session. So for today's session, I'm going to share a brief presentation on breast cancer. So this is based on my experience as a pathologist. So I think the gist of my presentation today is what is important for us to know in order to help and contribute in reducing the burden of breast cancer in Malaysia. So my topic for presentation is scientific perspective on breast cancer from pathology to practice. So this is the overview of my presentation. I divide my presentation into two parts. The first part will be introduction to breast cancer, which include understand the burden of breast cancer and importance of awareness in breast cancer. The second part of my presentation will be to highlight and recognize the role of pathology in diagnosis and prognosis and appreciate the biomarker guided treatment. So how and what we do in pathology actually that help the clinician to tailor the treatment and management of breast cancer patient. Okay, so first of all, let us discuss what is breast cancer. So breast cancer is a malignant disease in which abnormal cells from the breast duct or lobules grow uncontrollably, forming a tumor. So initially, this is a normal breast duct. So the initial part will be a typical hyperplasia. Okay, at this stage, this is still considered benign. So as this lesion progress, it will become carcinoma in situ, and then it will progress further to invasive carcinoma, whereby the cancer cell will break through the wall of the duct and invade the surrounding structures. So these malignant cells can also infiltrate the blood vessels, and when this occurs, okay, the cancer will spread all over, and we say that it has metastasized to distant organ, for example, the brain, lung, liver, and bone. Okay, if a patient presented at this stage, it means that it's already advanced carcinoma. So what I'm projecting here is the many phases of breast cancer that we usually see in our practices. Okay, so why breast cancers matters, right? So let's see the burden of breast cancer worldwide. So breast cancer is the most commonly diagnosed cancer in females, accounting for 24% of all female cancers, and this is the leading cause of female cancers death worldwide. Breast cancers, 99% is seen in female and 1% is seen in male. So male do get breast cancer, but very rare. Okay, and together they account for 11.6%, and this make breast cancer the second most common cancer overall. So what happened in Malaysia? Okay, according to the National Cancer Registry, breast cancer is the most common cancers in Malaysia, followed by other type of cancer. Okay, let's see in female. Okay, in 2016 as well as NCR published in 2021, breast cancer is still the most common cancer diagnosed in female in Malaysia, followed by colorectal, lung, corpus uterus, ovary, and cervix cancer. So age-specific incidence, according to NCR 2021, breast cancer was seen to be more diagnosed at the age of 40 years old in comparison to data in 2016. Okay, in 40 years old as well as 65 to 69 years old in comparison to the previous NCR in 2016. So when it comes to lifetime risk, in 2021, around 1 in 23 female in Malaysia will get a lifetime risk of getting breast cancer. So they divide into a different risk. This breast cancer is commonly seen in Indians with the value of 1 in 17, in Chinese 1 in 19, and Malays 1 in 26. Okay. So what is worrying here is 50% of breast cancer patient actually diagnosed at late stage, which is stage 3 and stage 4. So stage 4 means the disease has already metastasized, and stage 3 is involvement of multiple lymph nodes. So in conclusion, we conclude that this is late stage, and when patient presented with late stage, it is more or less equal to poor prognosis. Okay. So a risk factor, what are the risk factors of breast cancer? When we talk about risk factors, we usually divide risk factors of breast cancer into modifiable and non-modifiable risk factors. What does it mean by modifiable risk factors? Modifiable risk factors is the risk factor that we can actually change. Okay, we have the power to change the risk factor, for example, lifestyle, etc. Whereas non-modifiable risk factors is a risk factor that we cannot change. Okay, so let's see what are the modifiable risk factors. The first one will be child or older age at first childbirth, or low parity or nulliparity. Nulliparity means a female, a lady with no children. Okay, no children, and then this has been shown to be associated with increased risk of luminal tumor. Okay, we will see later what is luminal tumor. The next risk factor is hormone replacement therapy or OCPs. So this hormone replacement therapy is very significant, especially if it's given to a postmenopausal lady. So whenever you want to take a supplement or oral contraceptive hormone replacement therapy, it must be advised by a practicing clinician. Okay, get an advice from your doctor. Do not get it over the counter, or do not simply take any jamu or supplement pills that we do not know what are the contents. So my concern here is that these supplement, etc., might contain hormone that might predispose us to breast cancer. So other factors is breastfeeding. Breastfeeding is said to be protective for breast cancer. So those lady who did not breastfeed has a slightly increased risk of developing breast cancer. Other risk factors include a diet rich in fat or red meat and poor in fiber and fruits, physical inactivity, obesity. Obesity is basically because of the peripheral conversion of the fat to estrogen. So this will further increase the risk of breast cancer. Smoking and alcohol is associated with moderate increase in the risk of breast cancer. So these are some of the modifiable risk factors that we can actually control. So now let's see what are the non-modifiable risk factors. Okay, for the non-modifiable risk factors, the first and foremost is unfortunately being a woman. Okay, but nevertheless, okay, because this disease is seen 99% in women, so of course being a woman is a risk factor to develop breast cancer. Okay, and the next factor will be family history of breast cancer, especially in the first degree relative. So what does it mean by first degree relative? First degree relative means mother, grandmother, siblings, or a paternal or maternal auntie. So if we have this strong family history, we have to alert the clinical side. Okay, we have to make them know that, okay, I do have a history of family history of breast cancer. Do not hide such an important history. Okay, and then the next one will be mutation in the BRCA1 or BRCA2 gene. I will come back to this after this. And then the next factor will be early menarche and late menopause, because again, exposure of the hormone. Previous history of breast disease, for example, ductal carcinoma in situ, atypical hyperplasia. All this disease is a proliferative lesion of the breast, and it carry a significant risk of developing breast cancer. So in those ladies who have been diagnosed with this disease, usually the clinician, the surgical site will have a regular follow-up with them. Okay, just to minimize and to ensure that they don't have a progression to breast cancers. And of course, older age group also is a risk factor, as we seen earlier. More cases are seen in older age group. So coming back to mutation in BRCA1 and BRCA2 gene, what are these genes actually? BRCA1 gene stands for breast cancer gene. So basically, each and every one of us, we do have this BRCA gene, which is normal. So what are these genes? This is a tumor suppressor gene. So their function is actually to repair the damaged DNA. Every day in our body, there's always a damaged DNA because our cell is dividing, okay, to replace the loss, etc. So when there is damaged DNA, this BRCA gene will repair the damaged DNA at regular interval, okay, at very full capacity. So in a person with a mutated BRCA gene, so this gene, this defect gene, they cannot perform their usual function to repair the DNA damage. So because of that, there will be accumulation of these damaged cells, and these cells will continue to proliferate, and this is the reason why patient with mutation in BRCA gene has increased risk in breast cancer. Okay, it is said that those with mutation in BRCA gene has 4 to 5 times increased risk in breast cancer in comparison to others who did not have the mutation in this gene. So this BRCA gene, bear in mind, it does not only associated with breast cancer, it can also associated with ovarian cancer, pancreatic cancer, and prostate cancer in male. Okay, I think everybody know this lady, okay, Angelina Jolie. So around 2012 or 2013 like that, okay, Angelina Jolie has shocked the world with her decision to do a prophylactic or preventive bilateral mastectomy. Okay, so Angelina Jolie was tested positive for BRCA1 gene mutation, and she opted for the preventive surgery. Following the bilateral mastectomy, she actually did bilateral salpingo-oophorectomy and salpingectomy. Okay, so she also removed bilateral ovaries. So why does she opted for the BRCA gene mutation? Is because that her mother had a history of breast cancer, not breast cancer, of ovarian cancer, and she died of ovarian cancer. So because of that, she went for a testing for BRCA gene and tested positive. She took the initiative. So in her, she was told by the physician that by doing that procedure, the risk of developing cancers from 80% reduced to just 5%. So during that time, there is surge in testing of BRCA gene at that time, even though it's not sustained, but they call it the Angelina effect. Okay, so familial breast cancer, who is at risk actually? Here I have listed some of the possible risk factor to get familial breast cancer. Okay, those who get ovarian cancers, breast cancer in patient diagnosed in less than 45 years old, 2 primary breast cancers, both diagnosed at the age of less than 60, triple negative breast cancer. I will tell you what is triple negative later. Diagnosed less than 60 years old. Male breast cancer is also a hint that this might be associated with familial breast cancer. Breast cancer plus parents, sibling, or children with any of the above criteria. So those with this criteria is actually at risk of having familial breast cancer. So individual with pathogenic or likely pathogenic variant of BRCA1 and BRCA2 have an increased risk of breast, ovarian, and a number of other related cancers, as I mentioned earlier. So these individuals need earlier and more intensive screening, okay, and preventive surgeries, okay, preventive strategies. So what are the symptoms of breast cancer? So basically, symptom of breast cancer, the most common symptom is palpable mass. Okay, patient usually came in with palpable mass, and apart from that, there might be other associated symptoms. For example, skin retraction, nipple inversion, nipple discharge, skin ulceration, redness, and warmth of the skin. So this is a diagram that I got from this website, Know Your Lemons. So they actually compare symptoms of breast cancer to a lemon. So what are the symptoms? Of course, hard lump is the most common symptoms. Next will be orange peel appearance of the skin, okay, a different size or shape of the breast, sunken nipple, okay, prominent vessels, any bump, thickened area, dimple, nipple crust, okay, red or warm changes of the skin, and discharge from the nipple, especially blood discharge. So all these symptoms we need to recognize, and if we do have this, please do come forward for further evaluation. So what to do? Okay, what to do in order to recognize this symptom? Okay, screening and early detection. Screening for breast cancer is performed in individual without any sign or symptoms of disease for early detection and best chance of survival. So know your body and do breast self-examination on a monthly basis as early as 20 years old. Okay, so although breast examination is not a screening method, it is advocated to raise awareness of breast cancer and empower women to take responsibility for their own health. So then the screening method will be the clinical breast examination. So this is a very important component whereby a clinical encounter to maximize the earliest detection of palpable cancers. And according to the Malaysian CPG for breast cancers, this clinical breast examination by trained personnel must be initiated as early as age of 35 years old. Okay, to summarize the screening of breast cancer, at all ages, we advise breast self-examination at least once a month. Okay, in 20 to 39 years old, clinical breast examination every 1 to 3 years. Okay, more than 40 years old is mammogram or ultrasound at least yearly. And in high-risk individual, who is the high-risk individual? They are the one that I mentioned earlier with the family history and all the criteria that have been mentioned earlier. So mammogram and ultrasound is advised to be started earlier than 40 years old because they have a greater risk of developing breast cancer. So screening and detecting a lump is one thing, but once a lump is detected, coming forward and get assessment and diagnosis is another issue, because in some of us we might feel afraid, we don't want to go to the hospital, okay, and this will contribute to the 50% of breast cancer that is detected at a later stage. Okay, so what to do when there is a lump? So usually the clinical site will adopt triple assessment, what they call as triple assessment. They will do a clinical assessment first. Okay, they will assess the lump, and then they will subject the patient for imaging, be it ultrasound or mammography. So depending on the result of ultrasound, usually the radiologists will report in their reporting system, BIRAT 4, BIRAT 3, BIRAT 5. Okay, so usually if it's, they will review the report and then they will plan for tissue biopsy. Tissue biopsy is a must to confirm whether the nature of the lump. Okay, is it carcinoma or is it a benign disease? Okay, bear in mind, if you have a lump, it doesn't equal to cancer. Okay, there is a lump that is benign. So that's why it is important for you to come forward so that we can do assessment and confirm the diagnosis. Okay, so based on the imaging, clinician will decide whether to do a needle core biopsy to send for HPE, histopathological examination, or they want to do a minimally invasive procedure, which is FNSC first, and this will be sent for cytology assessment. Okay, and where is my role as a pathologist? Okay, this is basically our role as a pathologist in the tissue biopsy. So what is the patient's journey from screening to diagnosis? Okay, first screening. So when a lump is detected, patient will come forward for the triple assessment, and then after the clinical assessment, they will go for imaging. So depending on the imaging finding, usually if it's BIRAT 4 or 5, the lesion is highly suspicious for carcinoma. So they will do a tissue biopsy. So here, when a tissue biopsy is done, this is my role. Okay, pathology is always in the middle of the decision. Okay, so the clinician will decide and will plan for the treatment and management for the patient based on our biopsy report. Okay, after we release our biopsy report, the clinician will decide if it's malignant, then they will decide whether to put the patient on neoadjuvant first or they want to do mastectomy straight away. Okay, if they do mastectomy straight away, we will evaluate the mastectomy specimen, okay, and we will produce a report. So our report is basically the mode of conversation between a pathologist and a clinician. Okay, we put everything that we want to tell a clinician and oncologist about this patient tumor. Okay, what is the grade? What are the margin status? What is the lymph node involvement? Okay, what is the type of the tumor? Everything will be in our report, and oncologist or the surgeon will use this to further escalate or de-escalate patient treatment and management later. So basically, the pathologist's role in breast cancer treatment team has evolved, okay, from just diagnosis of breast cancer, from confirming of breast cancer to providing a growing list of prognostic and predictive parameters so that individualized treatment can be made by the oncologist or the surgeon. Okay, what we usually put in our report is confirmation of the malignancy, determine the tumor type, determine the grade, assess the margin, lymph node status, and molecular classification. Molecular classification is very important, especially when the clinician wants to decide whether or not this patient will be benefit from the anti-hormonal treatment. So this all that we put in our report actually is the prognostic markers that clinician can find for the patient. So I'm going to share a case here. Just recently encountered this case. So this is a case of 46-year-old lady. She complained of right breast mass for 2 to 3 month duration. She first noticed it when her bra was stained with blood. So she has dimple discharge, which is a bloody discharge. And this symptom was associated with breast pain for the past 2 months, and the pain was aggravated during menses. There is overlying skin changes and further history. Patient was married for 12 years. However, unfortunately, she is nulliparous. She denied any history of taking any hormonal supplement before, and there is no family history of malignancy. So on examination, the right breast, there is breast lump palpable measuring 4 times 3 centimeter. Okay, it's quite big. The lump is hard, fixed to the overlying skin with ulceration of the skin, nipple retraction. However, there is no discharge noted. Right axillary lymph node was palpable. On the left side, there is normal and no axillary lymph node palpable. So at this first encounter itself, I believe that the clinical site has a very strong suspicious of invasive carcinoma because patient presented with lump and there is overlying skin changes as well. So on the first encounter with the patient itself, they had already decided to do a needle core biopsy even before they haven't submitted for radiology yet, because this is a very prominent sign and alarming sign that this patient might be having invasive carcinoma, so they don't want to delay anymore. So they did a true cut biopsy and sent it to us in the lab. So what we received in the lab was multiple strips of tissue. Here in this slide, the tissue has been processed and produced into a glass slide. We have 5 strips of tissue. So what do we see under microscope? Okay. So this picture here, this is the patient sample, and I put here as well a normal breast tissue for comparison. So normal breast tissue is made up of terminal ductal lobular unit composed of lobules of acini with a duct and surrounding fibroadipose tissue as a support for this terminal ductal lobular unit. But look at the patient sample. Okay, you can argue with me. Are you sure this is the patient sample? Because it doesn't look like breast. Yes, because this breast was already infiltrated by malignant cell. Okay, we did a few markers for this, including E-cadherin, and E-cadherin came back as negative. So the final interpretation for this is right breast invasive lobular carcinoma. So the current practice in breast biopsy is that we do a reflex testing for hormonal status, which is estrogen receptor, progesterone receptor, and HER2 receptor. Okay, so for this patient, the estrogen receptor came back as positive. You can see that this is all the tumor cells, and this brownish color staining of the nucleus indicate that this estrogen receptor is positive. Progesterone receptor is also positive, but however, HER2 was a negative. There is no membranous staining of HER2. Okay. So we released this case as invasive lobular breast carcinoma. After the clinician read our report, they start this patient on hormonal therapy, which is tamoxifen, because the ER and PR receptor is positive. So if ER and PR receptor came back as negative, patient will not benefit from the hormonal therapy. Okay, the only option for her will be chemo or radiotherapy. So this is an advantage for her because estrogen receptor was positive. So after the report came back as invasive carcinoma, the oncologist decided to do CT scan for clinical staging. Okay, so clinical staging, they do CT scan of abdomen and thorax. Okay, the CT scan came back as a right retroareolar enhancing spiculated lesion with nipple areola complex involvement associated with right nipple retraction. So this is basically the breast tumor. However, there is evidence of metastasis to bone and liver. So unfortunately, this patient also presented at a late stage because the tumor has already met to bone and liver. So diagnosis at this time was invasive lobular breast carcinoma with metastasis to liver and bone, and they staged this patient as stage 4 because there is evidence of metastasis. So they explained to the patient that at this particular moment, at this stage, treatment is not curative but aim just to control the disease. So since ER and PR was positive, they plan to continue the anti-hormone treatment, which is tamoxifen, and they want to induce menopause because they want to cut the supply of estrogen to prevent further proliferation of the tumor. The option given was surgery, medication, and radiotherapy. Okay, so for this patient, she actually opted for surgery. All right, so staging of breast cancer, we have two staging options. The first one is anatomical staging, and the second one is prognostic staging, which we have clinical and pathological staging. In this patient, we don't have pathological staging because mastectomy was not done for her. So they only have a clinical prognostic stage. And the stage that we use worldwide is the NM staging system, whereby we evaluate the size of the tumor, lymph node involvement, and the evidence of metastasis. So just for your information, this is the staging system that had been used. Tumor category, which is the size of the tumor, the lymph node involvement, and evidence of metastasis. So anatomical staging. So in this patient, just now the tumor is 3 to 4 centimeter. So by right, it falls under category of T2. However, the patient has evidence of metastasis. So straight away, they staged her in the category of stage 4. Okay, evidence of metastasis. And lymph node involvement and tumor size doesn't matter anymore because she already had metastasis to the bone and liver. So this patient is stage 4. So just now we discussed that patient agree for surgery to induce menopause. They did a bilateral salpingo-oophorectomy. They removed the ovary and fallopian tube to induce menopause. Again, unfortunately, in this patient, the HPE of the bilateral ovary came back as metastatic invasive lobular carcinoma. Okay, this is a normal ovary for reference. Okay, this is how an ovary should look like. But in this patient, her ovary had already been infiltrated by this malignant cell. By morphology and immunohistochemistry that we did, consistent with metastatic invasive lobular carcinoma from the breast. Okay, so final diagnosis is invasive lobular breast carcinoma with metastasis to liver, bone, and bilateral ovary, stage 4. And molecular classification for this patient is luminal A, and she was already started on tamoxifen and they continue the treatment lah. So basically, so the issue here is patient noticed a lump for like 2 to 3 months, but presented to us already in a later stage. So issue here is it the patient's fault that she come in late, but she just noticed it 2 to 3 months ago. So the problem with this case is the subtype of breast cancer. This patient is having invasive lobular carcinoma. So invasive lobular breast cancer is a very nasty cancer. Okay, it is known to be very infiltrative, and sometimes at an early stage, it doesn't form a discrete mass like what breast cancer of no special type do. Okay, so they tend to just form maybe some irregularities and we might miss that. Okay, so the moment the patient notices the lump, it's already late. So the issue here is the subtype of the breast carcinoma, and based on what I have shown earlier, the one risk factor that we can identify in this patient is of course female, and number 2 is nulliparous. Okay, so next I would like to discuss on the molecular classification of breast cancer and why. So in 2022, a molecular classification of breast cancer was introduced by means of global gene expression profiling, or GEP. So this method, they actually using a complementary DNA microarrays, and they divide this breast cancer into 5 major molecular subtypes, which is luminal A, luminal B, normal breast-like, HER2 enriched, and basal-like, and this subtype had shown various clinical outcome and responses to neoadjuvant therapy. So GEP is not readily available in most of the diagnostic centers. Okay, even in center that I practice also, we don't have GEP. So they did a further study. So in 2011, immunohistochemistry surrogate of molecular classification for breast cancer was proposed at the 11th St. Gallen International Breast Cancer Conference expert panel. So here, they actually divide breast cancer into a molecular subtype which is similar to GEP, but they use immunohistochemistry to divide it. So this is an advantage because immunohistochemistry is widely available in most of diagnostic centers. So they divide into luminal A, luminal B, HER2 overexpression, and triple negative breast cancer. So this classification again provide accurate information about patient-specific prognosis, risk of relapse, and probability for pathological complete response. So major advantage here is identification of patient for whom the benefits of neoadjuvant therapy. Neoadjuvant therapy means a therapy that was given to the patient prior to mastectomy specimen. So aim is to reduce the size of the tumor so that when it comes to surgery, the tumor already shrink, and maybe they can subject the patient for a reconstructive surgery. Okay, so they can reconstruct the breast for cosmetic reason as well. Okay, so how do we do this classification actually? So for every biopsy that we receive, we will do 3 panel or 3 hormonal panel, which is ER, estrogen receptor, progesterone receptor, and HER2. So when to say luminal A, B, or HER2, luminal A is ER positive, PR positive, HER2 negative, and low Ki67 as what we see in this patient. Luminal B is ER positive, PR positive, HER2 may or may not be positive. HER2 enriched is ER and PR negative, and HER2 is positive. Basal-like is triple negative. All the 3 hormonal markers are negative. So what is the significance of this molecular classification? Of course, one of it is the treatment, okay, hormonal treatment. Number 2 is the prognosis. Okay, luminal A and B carries a better prognosis in comparison to HER2 rich and basal-like. So those who tested to be luminal A, they have advantage of hormonal therapy and they carry good prognosis. Okay, HER2 is a bit tricky. Okay, positive for HER2 carry poor prognosis. However, with the current advancements, we found that there is HER2 targeted therapies. Okay, and this patient still benefit from this HER2 targeted therapies regardless of the poor prognosis. So basal-like, there is no other option, no targeted treatment. So that means the patient only left with chemo and radiotherapy. And basal-like is associated with the most poor prognosis. So again, this is the hormonal status for the patient that we have discussed earlier. So as mentioned earlier, prognostic and predictive practice is what our report consists of. What we report is the tumor size of the patient. Okay, larger size at diagnosis, of course, associated with long-term risk of recurrence and lower breast cancer specific survival. Lymph node involvement the outcome is worse compared to those with lymph node negative. Higher grade cancers associated with more aggressive behaviors and shorter times to recur and progress. Okay, and LVSI, lymphovascular invasion, is associated with high risk of local recurrence and lymph node metastasis. ER carry both prognostic and predictive. Prognostic means we want to predict the outcome of the cancer, and predictive is the prediction of the potential benefit from the therapies. So ER positivity, even the positivity is just 1%, it's just in one cell. We need to report because there is still a chance that patient can still benefit from the hormonal therapy. Okay, HER2 also carry both prognostic and predictive factors. Okay, because there is targeted therapy. Okay, and HER2 positivity carry poor prognosis, as I mentioned earlier. So breast cancer survival rate, they are very high for early stage detection. That's why our aim for screening is to detect breast cancer early, okay, with the overall 5-year survival rate around 90 to 92%. Okay, but this rate, they vary significantly by stage and few other factors, for example, the age, race, the treatment, okay, and few other factors, few other prognostic factors. Okay, the survival rate will be 90 to 95% for localized or early stage disease, drop to 87% for regional. Regional means involvement of nearby lymph nodes, and the rate significantly dropped to 32% for a disease with evidence of distant metastasis. So we understand here that a disease with distant metastasis is actually a very poor prognosis, carry poor prognosis. So we talk about breast cancers and female all the time female. So what about male? What is the role of men and breast cancer? Okay, men also has an important role in encouraging women in their families to perform regular breast self-examination, because early detection is the key to reduce the burden of breast cancer. So don't think that you don't have a role. You do have a role to spread awareness. Okay, remember that breast cancer is a disease that affects the whole family. Okay, and support for the affected woman is very important and very much needed. And also important fact to remember that breast cancer can also affect men, even though it is rare, but it does happen. For every 100 diagnosed women, 1 man is diagnosed with breast cancer. So symptoms of breast cancer in men are the same as in women. So if you detect any abnormality, it should be reported immediately. Okay, do not delay, be it men or women, any abnormality that you detect, please come forward and to get it assessed and evaluate further. Okay, I have come towards the end of my presentation. So for Muslims, we do have a hadith from our Prophet, Sahih Bukhari and Muslim. God has not sent down a disease except that He has also sent down its cure. So some of my students might argue that, Doctor, how about HIV? You don't have the cure. So I believe that there is cure somewhere out there. It's just that we haven't found it yet. So what we learn here is a disease is a part of divine wisdom. So seeking medical care, early screening, and supporting patients are acts of responsibility, faith, and compassion. Supporting women with breast cancer is not only a medical duty, but also a moral and religious obligation. So let us work together, men and women, to raise awareness, promote early detection, and provide strong family and community support. So to end, I would like to stress again, awareness is as important as technology. Okay, it doesn't matter if we have such an advanced technology, advanced treatment, but the awareness is not there. So how are we going to detect this breast cancer at an early stage for a better outcome? So we need to detect early because early stage cancers have significant better survival. So how to detect early? Again, we will go back to awareness and screening. So actually, where does all this started? It started from us, okay, from us, okay, not from the KKM, not from the clinician side, okay. It actually start with this. Okay, what we choose and how we want to prioritize our health. Okay, so I think that will be the end of my sharing session. With that, I thank you. So I open for any question. I believe that there will be a Q&A session after the second keynote talk. So I will address the question after that, during that session. Thank you very much.
Thank you, Dr. Aliza, for the insightful presentation. Next, we are pleased to invite Mr. Kavyarasu Anatlaki Pongavanam for the second keynote speech with title Elevating Care Through Ergonomic Preventive Approach to Workplace Health.
Okay, all right. Good morning. Good morning and salam sejahtera to everyone. So I won't be seeing any faces of the participants, is it? So I'll be looking at blank screen. All right, first of all, thank you for the organizing committee of the 20th Undergraduate Colloquium on Health Science 2026, and especially to my respected lecturer for the invitation. It is truly an honor for me to be here today. I just need to admit that I feel a little nervous speaking to all of you today, not because of the topic, but because this is the very university where I once sat as a student, just like you all there. So it's like bringing back my many memories, lecturers, excitements, the moments of uncertainty about the future. Anyway, I'm Kavya Arasu, and I'm an alumnus of this university, UDSL. After graduating, my journey led me into a lot of field. Okay, so I once worked in Zunagara Hospital. Then I worked with Wildlife Conservation Society, finally ending up into the field of occupational safety, health, and ergonomics, where I have spent several years working closely with real workplaces, real workers, and real challenges. All right. So I hope you are doing well. And okay, since I won't be able to see any of you guys, hopefully no one attending this talk from your bed, though I know some of you might be. All right, before we start, let me ask you a simple question, right? How many of you are sitting comfortably right now? Neck straight, back supported, feet on the floor, or are you just bending forward like a shrimp? Check yourself there. So if your neck is already tired, congratulations, you're already experiencing ergonomics in real life. Like today, we are going to talk about ergonomics, but don't worry, because this is not a boring safety lecture, right? Purposely, my first slide itself will make you make your eyes painful, right? So many words around the ergonomics. No problem. Today we're gonna talk about ergonomics, which is actually about making life easier and not harder, actually. All right, so it's about designing work, your study, and even daily activities so that your body doesn't suffer silently. Many people actually thinks ergonomics only applies in factories, workers, office staff. No, but let me tell you something, that students are one of the highest risk groups actually. Think about it. Your long hours on laptop, non-stop scrolling on phones, online classes, assignments until early morning, sitting sitting and more sitting. So that neck pain, shoulder stiffness, or the back discomfort you feel, that's not normal student life. That's poor ergonomic actually. So today I'll be sharing on topics elevating care through ergonomics, a preventive approach to workplace health. So most of the time ergonomics just often misunderstood as just, oh, it's a chair adjustment or a posture correction, but in reality it is about care. Like, it's about caring for the human body and mind before injuries, pain, or illness occur. Well, research helps us to understand how the human body reacts to work. So ergonomic uses their research to design safer tasks, right? And care means protecting people before injuries happen, not after. Okay, so this talk on ergonomics is going to be based on guidelines on ergonomics risk assessment at workplace 2017 by DOSH. But don't worry, I'll explain everything in a simple, practical way. No complicated terms, no heavy calculations, just real life examples that you can apply immediately. All right. So by end of this session, my hope is like you'll understand what this ergonomic really is. You'll start noticing ergonomic risks around you. And most importantly, you realize that prevention starts now, not when you start working. All right. So let's begin, and don't worry, you are allowed to adjust your sitting posture anytime during this talk. Right. Okay. Now let's begin it. Ergonomics. So ergonomic basically a term came from Greek, right? Where the meaning of ergon is ergon and normal. So basically we're gonna be fitting a task on the worker. How we gonna fit a task or the workstation for the worker? It's not fitting worker to the task he's gonna do. All right. So it's reverse. How you gonna fit the task, the location, the workstation for that particular worker? Right. That's very important. Why? We'll see on. So definition part, why ergonomic matters at workplace and relevant to students and future professionals. So these are the main section that we will go through. All right. Now, team connection, how it's connected with the team. Now, empowering research through evidence-based ergonomics. So you already knew that research driven by data, it informs safer and more work effective designs, and it elevates care by protecting the workers health. Like, that's very important. Why? Workers health will determine the approach on the job task, and that particular job task is important for the production team. Why? It comes up with the income, that's the profit from the company when we are talking about a company or office. So workers health is very important for the particular office or company. All right. And we're going to see on the role of young professional in safe work design. So how you guys gonna be as you're gonna be the practitioner, how it's going to be your it brings the innovation and drive implementation into it. All right. Now, as I mentioned, so the root words were from Greek, where ergon means to work or to accomplish a task, and nomos means the law or the custom. So basically it's how you're going to fit the task to the person or to the workers. All right. So basically fitting the job to the worker, like how anyone will start to do when they let's say 8 o'clock they start their work schedule, right? They will go into the workstation, they will start to do. All right. Usually, the pity thing is foreign workers, right? When it comes foreign workers, in my experience, I've seen two type of foreign workers. The first one, they'll keep quiet on any situation, even though the work is a tough one and they are doing unnecessary job tasks. They'll just keep quiet, because in our economic assessment at workplace there are sections where we need to interview the workers. So we will have a particular questionnaire sheets. We will do the interview session with the workers. We will be asking what are the body parts they are having issue or pain, MSD pains during the working hours and everything. So this type, the first type, they will say everything okay, even though I can clearly see on my first eye itself, like they are suffering. Maybe they were like manual handling, they need to carry like heavy loads, or they need to work while standing for longer hours in a dust area, but surrounded by very noisy machines. They won't complain. They'll say all okay, right? The type 2 are those who gonna complain about everything. Oh, this one is not right, that one is not right, that's why I'm taking MC. So whenever there's an issue of taking MC due to any musculoskeletal disorders or body pain, right, I need to refer back to their HR department. Is it really confirmed by the doctor that the MC was taken because of any body pain during the working hours, right? In our evaluation, we need to see if the pain complained by the workers were because of the job task or something else. In real life, you will come across a lot of comments and reviews, but it's, as an ergonomist, it's our job to identify whether the pain that the worker complains actually from the job task he is performing, or sometimes these guys are going back home, usually, right? Usually they will be doing gardening, sports activity, they were injured, or let's say previously they have injuries, accident injuries, and they coming back here. So some of them are simply, they'll start to blame, oh, this is because of this work lah, it's very hard for me lah, and blah blah blah. However, it's our task, ergonomic task, to identify if whatever complaint comes from the worker, if it's really because of the work, the job task, or because of other activities. Whenever we go into HR department, they will randomly will say, oh no lah, these fellows are always giving reason to get a medical certificate, date off, right? So fitting the job. So we need to identify what are the issues they are facing and how we going to fit the job for the worker, right? Let's say it differs. Let's say the person is a tall guy like me. Okay, there's another colleague, a very short person. How are we going to fit that situation? We can't simply modify the workstation for each of them, right? The workstation going to be general, but what are the things we need to consider so that both the tall and the short guy can work at the same workstation? Next is the interaction between us humans. That's the main issue. Okay, this including our not just foreign, our local workers as well, right? So the interaction, are you voicing it? All right, majority of them, even last 2 weeks ago, I went for this factory. So the lady, the makcik there, she has to sit in a very bad condition plastic chair almost the whole shift. They were doing some polishing activity. I can clearly see it's very uncomfortable situation. The chair was very short-legged. The machine is higher than her shoulder, right? We will consider the body parts arrangements during the working hours, like how long a person rising the head or bending or rising the elbows higher than the shoulder. So this is all things that we need to consider when we evaluating the process. But the thing is, I was asking her, she's a local lady, I was asking her, like, Machi, did you ever complain about the situation to your safety department or HR? Oh, no, la, Ade, I never complain anything. But she's been suffering. She said, then how you facing it? She said, okay, every day I go back home, I'll try to get some ointment or anything, I'll sleep. Interaction is very important in this situation. I believe I'm not complaining about the employer, but such certain situation they need to voice out, right? Let's say in this situation, she's supposed to complain to her superior or the HR department or the safety department, saying that, okay, look at this. I'm going to be sitting here for 8 hours, 7 to 8 hours. The chair is very uncomfortable. Do something, right? So the interaction, even a teamwork interaction is very important. Let's say you have been carrying a heavy load, which is 50 kg, which is very heavy for you. You need to voice out. No, oh no, I won't be able to carry this. Need a trolley or a buddy system where two persons works on one task. Important. And basically, economics, we will focus on the safety, how comfortable and productivity you are. Like, let's say, for an example, if you guys are allowed to sit on a plastic chair, a small, short plastic chair, and the laptop is on your lap, how long you will feel comfortable sitting and listening to the talk, right? So, safety, important. Comfort, equally important, right? Now, why ergonomics matters, right? Why? Okay, so I have included three main section here. If when it comes company, factories, offices, there are more issues there. But generally, why it matters? It prevents work-related musculoskeletal disorders. Right. I'm not sure, as most of you are students here, I was informed there's lecturers as well. Try recall back your situation for those lecturers, right? When you're conducting your classes, most of the time you will be standing, all right? And students, most of the time, when I was doing my final year project at university there, right, requires me to be in the lab most of the time. So the situation, everything, even a noisy situation, the air conditioning in the room will cause issue with your body, right? Some workers, right? One of my uncle, he was happily working in Singapore as a bus driver for years, right? They will be seeing the currency rate, and he'll be saying, oh, even though I'm a bus driver, I'm earning a lot here, and blah blah blah. Now he having issue with his neck bone. Why? Because during the driving, right, he always need to look left and right continuously for years. Now this guy having a neck bone pain, where he'll feel a terrible pain turning his head left and right now. See, that's the problem. Now, what's the point earning a lot of money? End of the day, you are walking like a Terminator, Arnold Schwarzenegger, where you need to turn left and right, the whole body. Right. So it helps you to prevent any musculoskeletal disorders. You know how many of them having a lower back pain? Normally we will say as back pain. Working as a driver or sitting in the office. Okay, I've gone to offices like very local underrated companies and up to international companies. Everyone, it doesn't mean oh, these guys are in Google Office, they are provided with nice workstation and everything. Most of them will complain about lower back pain. Why? Because of the sitting. Even though you are using an ergonomical chair, very expensive, you got lumbar support, neck support, and blah blah blah. Still, if you're not taking your regular break times, micro breaks, end of the day, you're gonna get lower back pain. So you won't be able to say, oh, this all for factory workers only, ma. They are doing hard work shifts and everything. Office, you're sitting in a nice aircon room. What's the issue? No, for your information, ergonomics applies for all the industry. All the industry, basically every employer need to do ergonomics for their workers, except for those who are working on ship, on the ship, and our military. Okay, military and ship workers are not categorized for ergonomics. They are under another section of the DOSH. But DOSH concern of ergonomic applies to everyone, including the workers in mama shop. Okay, it's just they are not aware, the employer is not aware. They think, oh, ergonomic factory. All right, it improves efficiency and performance. Obviously, when you're comfortable to do a job task, then you will do it, you will perform well, right? Even when you're in your classroom, let's say you are provided with a, you know, the old folding chair. Those days we used to do, since I'm 80s kid, we were very aware of this kind of small, and somehow I'm a big size, will be provided with a small chair. At one point, after like 20-30 minutes, I won't be able to listen to the class. Why? It's not because I'm losing my patience on the teacher, but of the chair, uncomfortable, so it lacks my attention, my efficiency, my performance, right? Enhances quality of work and care. So it's all interrelated. When you're performing well, it enhances your quality. It brings for productions or companies, it brings efficiency, right? They can avoid absenteeism. Sometimes, like I've seen some companies, right, whenever we go to the section, almost empty. I will be like, only these numbers of workers are there. They'll say, oh, half of them on MC, because yesterday they had a huge production work units working for long hours, so they took MC. That's not correct. It's an incorrect, right? You need to plan. Whenever there's a huge number of production need to be done, you need a huge number of workers. Or let's say, oh, I don't have number of workers here, we only got few. Then you need to do the control measures. There will be a lot of control measures later, I'll be sharing on you guys, right? Okay, so why ergonomics is matter? To prevent your MSD, to improve performance and enhances the quality of work. Now, so basically this guideline, right, for just students on your section, it issued by DOSH. Okay, it gives a systematic approach to ergonomic risk and also applicable to all workplaces. So in this guideline, basically they have come, OSHA guideline section 25, if I'm not mistaken, requires the employer to provide a safe place, a safe working environment, place for the workers. So ergonomic comes under that section, where in order to provide comfortable and stress relieving work area. Okay, so remember this all the time. Majority of them are, to be honest, you don't go and tell any companies. I'm not going to give the name of any factory or companies here, but most of the time, though, to be honest, seriously, no harms. Only companies where the employers are from US and Japan will be considering doing this ergonomic assessment. I can see they really care about the workers' health and safety. So from those days, wherever I'm going, definitely I can see, oh, it's owned by Japanese or Americans. Why? They are concerned on the safety of the workers. But in current situation, our DOSH department, Kementerian Sumber Manusia, Kesuma, and DOSH departments are working on it to making this ergonomic risk assessment as a compulsory. Whenever I'm meeting any employers like local company owners, right, they'll be the first thing they're going to ask is it compulsory under the rules and regulations? Obviously I'll say no, but advisable. It's okay, nanti later we'll do. All right, so can you see the awareness here? But now recently they are working on the guidelines to make it under a regulation where it will, I think by suppose mid 2026, it should be a compulsory assessment for all companies. Hopefully it will work out, right? So this guideline actually provides a systematic approach on what are the reviews need to be done, what are type of observations, guidelines, and so on, right? It works on applying the control measures at the work section here. All right, let's come to the objective. I'm not sure if I'm going too slow or too fast. I'm not able to see your face reaction as well. Right. So basically, we're going to provide a systematic plan and an objective approach in identifying. You need to identify what are the ergonomic risk factors there. So it's not a simple work, Let's say you're going into, I cannot mention any company name. You're going to a company name A company. First, it comes from reception, office section, right? In the office section, basically, they'll have HR, finance, accounts, sales, and blah, blah, blah. All these can be categorized under office. Done. Gardener. Even gardener is one of the workers, like I've seen some employers like, oh, gardeners no need, you just do the assessment for the workers. No, they are workers. Basically, security guards, they are also included, but usually security guards gonna be third party, right? But if it's from their own personals, then we need to conduct. Okay, we need to conduct on them. And then we go to warehouse section, receiving section. Okay, and then the production, they might have rework area, they might have wastewater treatment plant, they might have a boiler house. So all here we need to go through their work task. All right, and we need to identify what are the economic risk factors. I give you one example. Receiving area or warehouse, usually warehouse and receiving area, the same for them. So when they receive raw material from their supplier, right, the supplier will drive the lorry, will park beside the gateway. All right, so the first task, when the worker brings down the boxes from the lorry to ground, the first one, or box arrangement we call it. Next, obviously they're gonna arrange it on a trolley or big trolley. If heavy loads, usually they will use a forklift. So I need to view forklift driver. When if it's a small boxes, they will arrange on the trolley. Then the second task, they're gonna push the trolley, right? What is the weight of the trolley? The tires, the small tires of the trolley, is it in a good condition? Are they pushing and pulling the trolley on a smooth surface? Smooth surface meaning smooth, no issues, no any breaks on the ground and everything, smooth all the way. And then we need to see, okay, they reach to the warehouse section, they're gonna unload. How they unloading the box? So each and every task of workers need to be monitored to identify what are the economic risk factors they are facing. And believe me, most of the time, these guys are working not even realizing that they are having issue, they are in economic risk. So later I'll explain what are the economic risk factors. Then we're going to assess level of risk. How bad is the risk now? So some of them will say, will tell me, for we still stick to the warehouse issue. So some of them will tell me, oh, these boxes will come every day morning. Okay, so I knew that, okay, this task is being performed every day. Then my next question, each loading and unloading, how long it's going to take? Then I need to assess that. Okay, when he says no, every time it's a small boxes, 10 minutes can be done. Okay, obviously I'll be asking, how come 10 minutes? Oh, we will be 10 of us. So 10 of us will be working to load and unload the boxes. Okay, buddy system, good. Or they might say, oh, it takes time because only 2 of us and the boxes are so many. So we will do slowly. Slowly, effective or not, depends on their break cycle. So we need to assess the risk level. Okay, sometimes they'll say, hey, no lah, this supplier will come once a month only. So that particular loading and unloading process gonna be once a month, and each session gonna be around 30 minutes. So it's not a big issue now. All right. And finally, to recommend control measures. So we already identified the economic risk factors. We already assessed the level of risk. Next, we need to apply the controlling economic factor. So as I mentioned, that's 2 type of workers, right? Usually local workers, I'm okay with them. They can understand the situation. They will be very supportive during the assessment. But it's very hard for us to explain about this ergonomic assessment to the foreign workers. Like they'll be scared. They will think like, okay, if I'm complaining anything, then they're gonna take action on me. They are like scared, to complain about the issue. But usually I will explain to them why he need to be open to us, so that we can know what are the risk factors he's facing and so on. So the communication during the identification of economic risk, a little bit. The worst part is when you recommend control measure, right? Later I'll explain why it's a huge issue when you need to recommend control measures. The issue is not from the workers, from the employer. Like, when is economic risk assessment needed? So usually in under DOSH, in our regulations, right? Obviously, whenever the worker complains of discomfort or pain, okay, whenever a worker, even one worker, come and complain to the superior or the HR department or the safety department, oh, I'm doing this task, it's very painful. Every day after 5 o'clock, I'm having shoulder pain or shoulder stiffness. they must take action. Or whenever the HR, usually whenever the workers are taking MC, right, medical certificate, they're gonna see a pattern. Hey, why this guys from this particular section always takes MC? So it's the employer's responsibility to investigate on the issue, which usually won't happen. They will be going to the section and say, oh, all you guys are always taking MCR, change your attitude. Done. They won't ask actually why you're taking MC, what is the problem, why we need to take consideration on the issue, and so on. But as I told you earlier, they need to decide. There's two group of workers. Some simply will give reason, oh, because we are having pain of the body part and blah blah blah. Simply not an issue. But there are real issues where they're facing problem with the work task, so they're taking MC or medical certificate. So whenever there's a complaint from a worker, employer must take action. All right. Second situation, high risk task identified. This comes under the safety officer of each company. Now, even with 5 and more workers, you already need to have OSH coordinator, right? So it comes under the OSH coordinator. So he need to identify if in this situation, let's say in my office, are they having issue there? Are the workers complaining about back pain? So the safety officer in factories and companies, they need to identify, are they lifting heavy loads? Are they discomfortable to do this particular task? And then they personally need to take action. In the guideline, there are few appendixes, right? So appendix 1, actually. Appendix 1 comes with a general questionnaire where the employer need to provide it to all the workers to get feedback from them. So usually it will be this kind of thick lah. Remember how many workers. So I will need to review all the response from the workers to identify are there any issues facing by the workers on MSD, body pains or not. And third situation, when new process or equipment introduced, whenever there's a new equipment, so the worker situation gonna be different, how they gonna perform and so on. So these are the main issues here. But at the moment, as I mentioned, government is planning to take into control where economic assessment will be compulsory for all industries, right? So I think they must follow whenever it comes. Identifying key economic risk factor. Now, what are the things we're gonna observe to identify the risk factor? So obviously, I'm gonna look into the posture, the body posture, how the guy is sitting. Look at me. I'm sitting here with comfortable. Oh, you won't be able to see that, right? Okay, so it's so-called ergonomic chair. So I got comfortable hand rest, which is can be adjusted according to my height. Okay, the forces, it's the spring. Okay, the spring is working good, so I don't have any stiffness or any discomfortables on my body while I'm sitting and doing my talk, right? The force, what are the high exertion force they are using, they are applying on the muscle, the joint. This comes when they carry, manual handling, when they carry. Even it applies to office staff, right? Remember, sometimes you need to carry the paper rim, you'll carry from your store to your photocopy machine, manual handling. Repetition, are they going to repeat the same process again and again and again? Some industrial area, okay, when they are working, maybe they need to repeat their arm or hand movement, right? Left and right, left and right. So continuous repetition without any break. Now, bring the concept to office. Normal office can be okay. Let's say it's a data entry, a call center. So the workers are using their fingers on the keyboards non-stop. That's repetition. The duration, how long? How long is the length of the exposure? And environmental factors. We'll go in details for this. Yeah. So the most common 7 ergonomic risk factors, right? The first one, awkward or poor posture, the whole body posture, static sustained posture, forceful exertion, repetitive motion, vibration, context stress, and environmental factors. So some of you cannot get the picture of it. So I'll go through a quick one for each, like awkward posture, right? So it's a situation where our body position is not on the neutral. Maybe you need to bend your body to reach to the file. Maybe the worker need to twist the body to reach to the materials. So usually this happens when the required item or work job task is situated where you need to move your body from the neutral position. That's called awkward posture. Simple. Let's say you are sitting on the table in your office. Simple example. In the office. And obviously, you need to take calls, right? Let's say you are in a sales and department or telemarketing. Your work, most of the time, you need to answer phone call. Suppose the phone should be nearby where you can reach the phone with a minimum movement, not placing it far from your desk or top of the desk where every time when call comes in, you need to overreach the phone. That's awkward posture. But let's say when you're doing it for once or twice in a day, fine, overreaching. But what if every 10 to 15 minutes you are getting called? How many times you gonna overreach to get the phone? That matters. Number 2, static and sustained posture. This is a posture, body posture or position that one held throughout the process. Okay? Again, I'll give you a simple example. Office, as I mentioned earlier. Office staff need to be seated for longer hours. Even though you are saying, no, I'm using ergonomic chair, so no problem sitting on long hours. No. Even though it's an ergonomic chair, you are maintaining the same sitting posture for a long hours. Suppose after 30 minutes, you need to stand up, do a small stretching, and then sit back again. Not continuously maintaining the same body position. Right? It gives numbness to the body parts. That's office. How about the production area? Some machine requires the workers to stand for long hours with minimal movement. Maybe just their hand arms are moving, the leg standing straight. Right? These are categorized under static or sustained posture. Generally, all office staff will be under this category. Forceful exertion, carrying a manual handling forces, right? Heavy boxes. What are the body positions you need to consider when you're carrying something, when you're picking up the load from ground? All right. even a small pinch. But cook, no. Cook gonna be using their pinch. It's not that kind of pinch. Pinch where they need to handle with small parts in the production area. Small nuts and bolts matters. Repetitive motion. See, repetitively you are doing something. Repetitively you are moving that particular body part non-stop for hours comes under this section. Okay, you are not giving enough recovery time for that particular body part. Okay, so that is why, like my uncle I told you just now, so the whole body parts are okay now except for the neck bone, because he keep on repetitively turning his head left and right. Okay, next, vibration. So vibration basically got two type. One is the whole body vibration. So the whole body vibrates. How? Forklift driver. Okay, forklift driver, the heavy load machine, like in the quarries, right? These kind of drivers are facing whole body vibration. And the second type is hand arm. So hand and arm, usually for those who are using the power tools like grinding. Okay, I've given you in the picture as well. The grinding. Have you seen sometimes they are using a tool to break the road? The main road, they will working on that, right? So where the vibration applies on the arm and hand, not the whole body. So vibration, when you are situated in a area like oil rigs, or oil and gas company, right? So when you are standing on the rigs, the whole rig will be vibrating. That applies to the whole body vibration. Contact stress, very simple. Whenever your body part is in contact with any hard or sharp surface, I'll give you simple example. You're sitting on your table, office stuff, especially when you're sitting on your table, if your keyboard and mouse is not in correct condition, your lower arm, okay, your lower arm gonna be in contact with the edge of the table. So that's why, suppose edge of the table should be curvy or covered with any soft cover, but most of the time it is not. Sharp edge on the table, and you are pressing your lower arm all the time on it. That's contact stress. All right, basically it's gonna be giving pressure on that particular area's nerve and the blood vessels, which will cause numbness in long term. And finally, environmental factors, like even though this is usually lack in others consideration, but very important, lighting. Okay, lighting for the workers area. So look at the picture I've given on the side. Like they are working under a very little lighting situation where they need to look, they need to strain their eyes. Not only lacking brightness as well. Some of the officers often complain to me, oh, there's a lot of lights, very stressful. So too bright issue, low bright issue. It need to be neutral. The temperature, are they working in a hot condition? But don't come and tell me, oh, sir, my office is very cold. Understandable. Office air conditioning is something that you can change, right? Let's say it's too cold, whether you're going to use a sweater, or generally if everyone accepts, you maybe can increase the temperature or turn off the air conditioner for a while. Then when you feel the heat, you can turn on. But what about the workers inside the factories. When like okay, I cannot mention the company name again. Okay, the companies working in steel area, sometimes they need to work around a boiler. These are very high temperature areas, noisiness, pressurized environment, usually those working in a confined space area. Air ventilation, how good is the air ventilation system there? Let's say it's a welding process area, everyone gonna be doing the welding process. How's the air ventilation there? Right, the welding part is called welding fume, right? So the welding fume will be around, it should be sucked out of the area, or else everyone there gonna be sitting and doing the welding along with the welding fume, very dangerous. So these are the environmental factors that we gonna consider on risk factors. All right, identifying work activities, as I mentioned earlier. So in our task, first we need to observe the work. Okay, my job requires a lot of patience and a lot of pictures and videos especially, right? So whenever we are going to the site, right, you need to observe the work. What are they doing? What is the cycle of the job task? And usually, to make it simple, I will take a video, minimum 1 minute video, so that time concentration, you won't be able to looking into each and every departments, each and every task for hours. 2 days, more than 3 days won't be enough, right? So usually we will observe the process and I'll take videos. So once we come back to office, we will go through the video again, so we can clearly see the movement, the turns, the heavy loads, the body posture clearly. Usually we will use the picture in the reports to explain to the employer what the situation. Then we need to interview the workers, like, okay, what are the issues they are facing, as I mentioned earlier, right? What are the issue? So these two groups, one will complain about everything. You need to consider, like, you need to assess, is this really from the work or due to some other activities they did at home? And if there's any injury, need to review that. The injury, was it earlier, maybe before joining here, they had accident, sports accident, issue with their knee, right? They already had the problem. So now they coming to this job and complain, oh, I'm having a knee problem. No, that was not due to the work. It's due to your previous accident. We need to consider all this, right? That's identify the work activities. Then usually we need to see what are the risk factor. Okay, are they having the static posture here? Are they the issue is about awkward posture? Are they carrying a lot of heavy? Are they doing something repetitively? Need to identify the risk factors first, and then we will do the assessment. So the assessment comes under qualitative assessment, semi-quantitative tools, and observation-based evaluation. Now, what is qualitative assessment? So basically, qualitative assessment is we'll be looking into the situation. What are the approaches they are taking? What are the work tasks they are doing? The interview session, the monitoring of job tasks. This is all categorized under qualitative assessment, right? So sometimes it really takes a lot of time. Really takes a lot of time because we want to see the whole cycle process, right? Some, like the other day, I was in this food industry. They are doing packaging food, right? So the same person doing loading and unloading, then he brings the raw material, storage, or some of the material to the freezer storage. Then the same guy is gonna take out the raw materials, let's say onions. the peeling cleaning process will be doing the same, and then the chopping, the cutting process, cleaning the vegetables, using it in the cooker. It takes time. You need to see the whole cycle of their process. Semi-quantitative tools. Now, basically, ergonomics currently in Malaysia under DOSH, ergonomics are in two ways. First, it's called initial ergonomic assessment, the same process. All right. So under this initial, we will be using certain checklists provided under the DOSH to come up with the risks. What are the risks they are facing? Okay, there are still situations where no risk at all, like the example of loading and unloading once a month, and each time it's gonna be 10 to 15 minutes, or this kind of situation, no problem. Okay, no problem. But let's say heavy load every day for 4 hours, this is a risk. So whenever there's a higher risk, we will bring it to the second level called advanced ergonomics risk assessment. So which we need to use certain tools, like here I've given you, the tools are very small actually. It's you need to compile a lot of activities under one single sheet. That's why it looks very small here, but you can Google later. You can Google ruler tools like rapid upper lower body, or it's called ROSA tool. ROSA is considered rapid office, a specific tool for office workers only. So you can see on the picture below there, right? So I need to see the quality of the chair, the knee position, the arm, how they reach the telephone, how they using the keyboard, the lower hand, lower arm, is it in touch with the edge of the table? The phone calls, let's say if it's a marketing department, the phone calls, are they using the normal phone? Are they using a headphone? All these need to be checked. REBA, REBA, rapid entire body assessment. So this applies when the worker moves around, when the worker standing. So when he is performing the task while standing, we need to compare this tool with the picture I took during the assessment. What is the position of the neck? What is the position of the back body? What is the position of the arm? How he is standing? The floor he is standing? All need to be considered. So we will use the video clippings, the screenshot picture, the posture of the worker with these tools, which were earlier, the tools were earlier invented, basically Westerners. So it's a general tool, applies in our regulations as well, approved by the DOSH department. We used to use against the workers' body posture to identify the risk level, if they need. So usually it will come up with points for each. Okay, I will see how much the hand movement, then they'll have guide. Okay, what are the score? How much is the neck bented? There's a score. So end of the day, we will calculate and come up with a score, and there's a guideline. Okay, let's say for an example, it's just 3 points. Okay, it's need to be considered as still safe as long as they maintain the correct body posture. Or let's say the score is 7. Oh, this is very dangerous situation. Immediately they need to take action. So tools, we use the tools, right? This is applies on the second level, advanced level. And the last one, observation based evaluation. So this is where I'm combining both qualitative and the tools. I'm looking at the videos, looking at the assessment I've done on the workers performing the task and the tools. Then we come up with evaluation. Do we need any issue, control measures here? What type of control measures? Why we need it? And so on. Now, on that part, so, as I mentioned here, after continue evaluate everything, we need to categorize that particular task. Is it low risk? Is it medium risk or high risk? High risk, obviously, you need to take the action immediately. What are the recommendation I'm giving? You need to take it immediately. Medium risk doesn't mean okay lah. You still need to work on it, but less effective. Like you need to consider performing. Usually our recommendation gonna be two type, mainly engineering control, administration control. Later we will go through. So in term of engineering control, we will see, oh okay, these categories are compulsory for high risk. Medium risk, majority of the time it will be slightly on engineering control, main on the administration control. Low risk, okay, this is the problem I'm facing with most of the employers. Low risk, oh no problem, they can continue. What? No, even though it's a low risk, continuously when they are performing the task, it gives problem, right? Even though they are receiving the raw material boxes once a month, but let's say for that particular month they need a huge number of production, so they're bringing in a lot of boxes. You cannot say, Allah, usually we will do once a day, for this month we are doing just 3 days continuously. What? Next month we will do once a day. So what's the big deal? No, you're already risking it. You're already doing it repetitively, even though it's a low risk. But when it is continued repetitively, you need to take action on that. But this kind of situation, we will modify the recommendation. Okay, this situation comes once a while, right? So what you need to do in this kind of situation? Suddenly a lot of raw material coming in. What are the action you need to take? Otherwise, you can continue with your normal working hours. So the risk evaluation is very important when we come up with the control measures. So what kind of control measures here? You need to eliminate certain situation you need to eliminate the particular task, the particular process, or you substitute. How are you going to substitute? Let's say I'm looking at this worker, he always carry heavy load boxes. Like in the assessment, I think I missed just now. In the assessment, usually when a person carries a box, we will be looking at it from a lot of viewpoints. Where what is the load? First of all, the gender. Is it a male or female? Next, the age. How old is the person? Next, the load, the weight, the box. How much is the weight? Like, is it 20 kg, 50 kg? How it's packaged in a box. Oh, box square and nice. Maybe you are thinking, yeah lah, when I carry something like on its own packaging, hard for me. When I carry in the box, easy for me. No, we ergonomists doesn't work like that. We will see the condition of the box. Is there any earlobes provided for you to comfortably carry the box? Or it's just normal box. You need to randomly pick the box from the side. Okay, and then we will come to the situation. How the position he's holding the box. Is it between the knee and waist, or is it between elbow and shoulder, or is it like they carrying above their shoulder? All this comes into situation. So whenever we can find the risk, how we going to substitute? Maybe I will say, okay, why you need to carry a lot of weight here? Use overhead crane. Meaning they will bring the crane to the box, they will click on it, and then they use the crane to move the box. So no human workload applies there. Substitute. You substitute another option there. Engineering control. Later I'll give you some examples. What are the engineering control? Basically, engineering control, installation and everything. Administration control from the office side. Personal protective equipment. Now, this is very important. Let's say it's a situation where your PPE, this is for, okay, since I'm industrial hygiene, I'll be doing ergonomic chemical exposure monitoring. So let's say this particular worker is working in a dust area. He need to use a PPE, a N95 particulate respirator. Okay, fine. But for ergonomics, usually we won't simply give recommendation on PPE. Why? Because most of the time they misunderstood. The N95 particular respirator mask for the worker really helps in terms of filtering the air. But for ergonomics, it works very less. It works not by hindering, but by supporting, giving even though for those who are carrying heavy loads, will be provided with back support. The name itself, support. Understand? It's not a preventive way, it's support. Still, okay, no problem. I'm wearing a back support. I can carry boxes throughout the working hours. That's wrong. That's what we don't want the workers to do. That is why I'll show you another hierarchy level. That is the important one. See, this is a standard hierarchy under the DOSH. The most effective is elimination. Whenever you can see the situation, eliminate. What is the correct way? What is the safe for the physical body to conduct that particular task? Then if you say, oh, we cannot eliminate, this is very important process, what we can do? Okay, fine, we can do substitute. How are we going to substitute the process? Oh, cannot. We must receive raw materials every day and for hours, and heavy load boxes. Then let's go for engineering control. Okay, place overhead crane or a trolley, simple boxes trolley. Right? You don't need to carry all the way from the warehouse receiving area to the storage. Place all the boxes on the trolley. Use trolley, push towards the storage area. Then administrative control. What the office can take action for them. I think I've included each and everything, right? Yeah. All right. So you can see the last part there, PPE. That is the least effective. But I'm not denying the process. Like obviously, for ergonomics, you'll have the anti-cut glove for vibration just now, right? They have anti-vibration glove. So whoever using the grinding machine, you can provide them. But that's the issue. Whenever these workers are provided with the PPE, they are like thinking on the chemical PPE, right? When you're using a respirator, you know that it filters almost all the contaminants, right? But PPE in ergonomics actually supports. Doesn't mean, okay, I'm wearing a back belt support, I can do this work non-stop. No, it's support. You still need to control your work positioning, the task. So PPE is the least effective. But to be honest, this hierarchy all the time will work upside down in the real world. It works upside down. Whenever we are bringing up the control measures, especially the employer, first thing is they will go to the PPE. Okay, Inche, you give me the PPE, we can use. Engineering control is very costly for us, and so on. But later I'll explain what are the issues we are facing with this. As I mentioned earlier, right? Assessing is not a big issue. Recommending is the big issue. Facing by us, the assessor, right? So engineering control at work. What kind of engineering control you gonna do? As I mentioned earlier, right? Adjustable workstation. There's a lot of high technology adjustable workstation. But but this part I need to get along with employers as well, because as I mentioned, from the price is terrible. The price is terrible. So whoever, let's say in that particular office, that 150 workers, that the other day I went there, right? It's a huge number of office workers there. When I'm saying, okay, boss, you need to supply them with ergonomic chair. Basically, this normal ergonomic chair itself, 200 something. Like let's say 150, one chair. 200 workers. How it's going to be costing? So, adjustable workstation are possible, but in real world, employers gonna be calculating the cost. That is the main issue we are facing. Otherwise, we can give a perfect workstation. Okay, give them a table that can be adjusted up and down. Give them ergonomic chair where we can adjust the whole chair, like the armrest, the whole body part, the seating, front and back, and everything. So this kind of situation, whoever, what type of worker's body, like even though that guy is huge, that guy is tall or too short, they can adjust themselves. Why? Because the chair can be adjusted, the table can be adjusted, so no problem. But imagine in real world the cost. Even I think earlier I have given you the picture where there are table and chair setting which you can control for doing a computer works while sitting, and you can use the same platform to do standing position, right? But usually I've seen in American companies, right, offices, right, they will have another workstation where after a few hours, right, the staff will be sitting in front of the laptop doing the task. After sometimes when they feel stiff or nerves, they can go to that particular workstation where you can do your work while standing. So they are given two options there. So you continue while standing and attending classes like this. So once after 1 hour, after 30 minutes, you're feeling the legs are very painful. Okay, go back to your office workstation. You can sit there. Okay, so doesn't mean you need to spend money to get high class tables and so on. Even simple aids are helpful. Mechanical aids, simple aids are helpful. Let's go to the office situation. Obviously, I will see, okay, the level of eye and the monitor need to be equally leveled. How? Okay, I'll go to the office stationaries or anywhere. We will find a box surface which we place the monitor to make it higher so that the eyesight will be equally leveled with the monitor. You don't have to spend. Even in recent online platforms, I'm seeing advertisement of a small wooden box they use to support the monitor. I think it costs 20 or 30 ringgits. No, a normal box can do the job, right? A normal, even personally myself, in my office, I seldom go to my office, but what I did, I took the A4 ream paper and I placed it below my monitor. Well, the concern is, as long as you need to have the level array with the monitor, right? Improve tool designs, right? Whenever the workers are using a screwdriver, a screwdriver, you need to use repetitive motion with your hand. What if you can use a battery powered screwdriver? Then the work, we can reduce the repetition process of you using a screwdriver. That's very important. All right, so this kind of machinery acts are considered under the engineering control. Oh, I'm getting into the time rush, is it? Okay, all right. Administration control is simple things that doesn't need any equipments or fixation. Job rotation. Okay, for the first half an hour, person A carries the boxes. Person B arranging the boxes on the store. So after 30 minutes, rotate them. Person A arrange the boxes on the store. Person B carries the boxes. That's all. Job rotation, very simple. Okay. Work rest schedules. Work rest schedules are providing them a micro breaks. Even this one also, when I'm saying, oh, you need to provide them micro breaks. Oh, Mr. Kavi, how many times they want to go to the canteen for the break? No, it's not canteen break. Micro breaks means whenever you are repetitively doing something, take a short break. When you are doing something by sitting, after 30 minutes, just stand up. Just stand up, walk around, and then come back, continue. That's the micro breaks. The name itself, micro, small breaks, around less than 5 minutes break. As long as you change the current position. So in your office, right, that's why we always advise them, make sure the pantry far from the office area. Make sure the photocopy machine far from the workstation, so that when you print, you must or you have to stand up, go to the photocopy machine and get the papers done. So these kind of simple control measures helps to change the continuous work posture. Training and awareness, that comes under the most important part, where you provide the awareness to the workers why this ergonomic is important. No, before that, you provide the awareness to the employer. Why the employer need to do the ergonomic assessment. And then you explain to the workers why the awareness. Whenever you are facing a back pain, you must come to the office, complain. Believe me, I'm not talking about foreign workers. Local workers also, majority of them not aware about this. Oh, it's okay lah, I'm having knee pain lah, it's okay lah, I go back home. No, they don't have the awareness. They need to complain this. This is not good. And training must be conducted all the time, on and off, to make sure they are following the control measures. Okay, I'm giving you the trolley for you to push the boxes, right? How many of them going to use? Majority of them, what they going to say, And no lah, we already carrying the boxes. Why suddenly we need to use trolley? They won't understand. It's the office, it's the ergonomist responsibility to explain to them why. Right? Role of research in ergonomics. As I mentioned earlier, especially as under the regulations, right? Whatever you're coming up with improvements, whatever the research you are doing, data is important. Right? In my situation, right, for each department, there's a questionnaire. For each department, I need to interview the workers to come up with a graph. A graph shows, okay, in this office, let's say office sections, right, majority of them having pain in the lower back, less in the foot. Second, majority of them having issue with their wrist. So the graph helps easily to understand, okay, in this particular section, majority of them facing this part of body pain. For this, I need a lot of raw data, right? Usually how we do conclusion, we need a huge number of data to come to a conclusion. In my situation, you know what? Sometimes the officer, okay, I can give you 2%, you interview them. Like in a huge office with more than 50 workers, how can I come to a conclusion just by interviewing two personals? Make sense or not? But it's my position where I need to explain to them. No, I need more numbers. Okay, in a production with hundreds of workers, how I can come to a conclusion with just 5%, even though 2 days ago I went to this company, vehicle company in Klang. The uncle was complaining to me. He was very pissed off, it seems. Oh, you guys are what? You coming in here and doing nothing? I've been working here for hours, working here for years, and nothing changed. This one is very hot. I'm still standing here, blah, 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 blah. It was like, he don't. I can see he's frustrated, but he's not listening. So I told him, no, uncle, I can't simply go and talk to the management or DOSH department. See, the uncle working here for 10 years, he's having a lot of issues here. No, I need data. I need data to prove my findings so that we can bring it to the authorities. Okay, see, this is the data. If we want to talk in a coffee shop, then yeah, oh, that plant is very hot. Oh, too bad. No air ventilation. But that doesn't apply when we go to management or the regulations team. We need to have data. So in that part, it's important. How innovatively you can design the workstation. Okay, improving. So I need to 11:30 now. Okay, so improving ergonomics in healthcare fields. Like how, as I mentioned, ergonomic doesn't apply just for the office and factories or production areas. It applies everywhere, including in your university, including in the hospital. So the patient handling risks. Sometimes, recently my mom was admitted. So she was admitted, she's the bed in the ward, okay, and there's a button to call the nurse in term of emergency. There's a button to call the nurse, right? So in private hospital, I've seen it will be connected to a long wire cable, so you can keep it beside your bed. Whenever you press it, they can hear the bell, the nurse comes in. But this hospital, I don't want to mention lah, the bell button is far from the bed, her bed. Like every time if she wants to call the nurse, she need to bend herself, overreaching to get to ring the bell. Can you see? It's simple. So ergonomics applies a lot in the patient handling, like to reduce. And then caregiver safety. It implements safety aids protocols to protect the staff. Like how you gonna protect them? As I mentioned earlier, it's very important to protect them, to care for them in order to get a better outcome for your company, for your office. Okay, and quality of care improvement. The quality is very important in order to get your productions. I need to, okay, I'll try to finish up by on time. Okay, student relevance on this issue. As I mentioned earlier, okay, I'm a student, I'm not working in office, I'm not in the factories, so I don't care about it. No, your laptop, your smartphone, most of the time. You know what, like, I'm this person who loves to read. So I always carry a book, right? Even though I go Sundays, I go to laundry, I'll put all my clothes. While waiting, I will be reading. That's my personal. I'm not saying using cell phones are bad, but majority of the time, wherever you go, those days when I was a young bat, my mom used to scold me. Hey, you kids nowadays always on the phone. But I don't think so that applies now. Nowadays I can see not just young students, even uncle aunties are very busy with their phone, right? Everywhere you go, the neck bent, like maybe you can see sideways. The neck will be bent. It's a disorder. When you are looking on to the screen for a long term, when your neck is bent, right? The uncle and aunties enjoying the reels, like scrolling, 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 while the neck is bent. That's gonna give a problem. Sometimes I'll advise the office staffs, right? Usually, by standard, you can have 20, 20, 20, like 20 minutes of looking into the monitor. And then after 20 minutes, you can blink your eyes 20 times or look into something that is 20 feet farther. Just simply look out. What they'll do, okay, we'll do that. So 20 minutes, monitor. Then 20 minutes, blink eye, look something else. What they'll do, after the 20 minutes, they'll start to use their handphone. No, I'm telling you to give a break for your eyes from looking into the monitor. What's the point? Okay, I'm not looking into my monitor, I'm going to look into my phone. No, you're stressing your eyes. Can you see the difference? Simple. After 20 minutes, give break to your eyes. Doesn't mean after looking at your laptop, you can look into your monitor. You're still stressing your eyes. So the simple thing, right? You standing up, doing a small stretching, and then sit. Done. Okay. The uses of the students. Okay. Don't get me wrong. Later, I don't want your lecturers complain to me. Oh, Mr. Kavi, you already say like that. Every time when I'm having my class, my students are standing every 30 minutes. Actually good. Why not lecturers try to do this? After 30 minutes of the lecture, you go to your chair and sit, while the students, ask them to stand up, ask them to do a small stretchings, and then sit back again, continue the class. Right? Study posture. You're going to sit, okay. You won't be able to lie to me because I'm also the same student from the same university. How are you going to sit? I've done my final year exam revision by even lying on the floor, standing beside the balcony. That was Bestari Jaya campus, right? So we'll have balcony there, right? So the body posture is important. Whether you're gonna sit, whether you're gonna lie down, whether you're gonna stand beside your balcony, doesn't matter. But do not continuously on the same posture. That's very important. When I was doing my final year project, that was the laboratory in Shah Alam Unicel, right? That is the moment I find out I won't suit into lab works, because majority of the time you need to sit on documentations and walk a bit, right? You will walk around to get the regions or anything, and then you'll come back, you have to sit, and you will be in the closed laboratory. I'm not saying everyone, for my situation, right? So it's hard. Need to walk around, need to get different experience, and then come back to the work. Okay, future workplace readiness. Like you going to the office, like after graduation, you walking into the office. Now you already got the knowledge on your ergonomics, right? So you need to approach when you're going to the office. Okay, this is not correct. The telephone is far away from myself. The documents that I usually use is far from us. Okay, you need the arrangement. Maybe later, if you can, or next time, I'll share the pictures, more pictures. I think I've included or not, I'm not sure. The arrangement of the table, office table, where you need to keep your keyboard, the mouse, the telephone, where you need to keep the secondary items that you use but not continuously, like your stationary things, where to keep the files, a tertiary arrangement for items that you seldom use. Important. Okay, Simple ergonomic tips for student. You guys, I think most of the things I explained earlier. So neutral sitting posture. So when you're sitting, I'm not asking you to every 5-10 minutes stand up in the class, but you can do in a group way, right? As I believe all lecturers also here, right? So why not every 30 minutes, you also standing while the lecturing part. So every 30 minutes, lecture can go sit for 5 minutes, ask the two students to stand up, do the stretching, and then continue. Obviously, it's going to work out in terms of your, not just in terms of your body pains, but also your concentration on the studies. And most of the time our faculties are nicely equipped with aircon, right? I still believe the condition is very good, very cold, very comfortable to sleep with the comfortable chair provided in our lecture halls. So this helps a lot on that. Okay, and screen at eye level, the monitor level, I already explained that, and regular breaks, what I've been telling you guys. Okay, so the implementation challenges, as I mentioned, lack of awareness. They don't want to care. Allah, this is not compulsory, I don't have to do lah. And then cost concerns. Oh, I cannot buy ergonomic chair, very expensive, give me something else. Resistant to change. They don't want to change. I've given you trolley, use the trolley, don't carry. You are that weighs a lot. No. I'm normal ready. I can carry the box. I don't need any trolleys. So the problems you are facing here. Next step on building the ergonomic forward culture, promote ergonomic culture. You guys promote yourself. Use research finding. Don't simply point out, oh, this one cannot, this one you must follow, No, give me the research findings. Students, you already knew about it, right? Empower future professionalism. Bring the awareness into yourself. Okay, bring the awareness into yourself before you are guiding others. So the key takeaways for the safer workplaces: first, ergonomic protects health. Remember, it's for your health. When your health is good, then only you can continue with your ambition. Then only you can continue with your work. Then only you can continue with your family. Okay, risk assessment is essential. With whatever you do, even when you're going to library to sit and do your revision, do the assessment. Are you sitting on a comfortable chair? Are you sitting for a prolonged hours? And everyone plays a role. Okay, doesn't mean okay that fella up to him lah. He want to sit for hours and do work. Play your role. Give advice to others also. Don't be so selfish, no. Okay, so empower research and elevate care. And then now you can start. I think this is the last one, right? Yes. So I believe we have come up with end of the thing. Sorry, I had to rush myself. Okay, so if there's any sections you are not clear, you can still ask questions with me. And in terms of understanding, I hope you guys already aware of the basic ideas, right? So you already know what is ergonomic, why it is important, what we're going to do with it, how we're going to do the assessment, on what basis we are going to do the assessment, research. The evaluations are very important. So what I observe, what I get from the tool, I evaluate, we come up with a control measure. Now with the recommendation, in your situation or in my situation, I can simply give all full pages of recommendation. You need to buy this, you need to buy this, you replace this, you change this, and blah, blah, blah. But end of the day, when it comes to the real life, cost is very important. So to be honest, in my situations, like most of the time it works. So usually I will draft the whole report, I give to the management. I'll say, okay, you go through. It's up to you and your management. Whichever cannot be included in your costing, you update me. So sometimes recently happened, well-known company in Selangor, they say, Mr. Kabir, can you I don't want this engineering control, very cost, just put admin control. No, in their situation, the workers are sitting on the very bad condition chair for hours. How I can be so, supporting the management? I'm saying it's okay, I can remove that. No, I told him, no, sorry, cannot. too bad. When DOSH sees the report, right, then they going through, they can see, oh, this is a bad condition. Why this assessor never give any general engineering control? Supposed to change the chair, change the total process. Right? It should be adjustable workplace. So in this kind of situation, we are facing problem. But when it comes students, you are still in a safe part where you the one gonna decide. You the one gonna evaluate yourself. Am I sitting in the correct position? Am I sitting for so long? Am I using a very dim room? Do I need to brighten up the living room or the study room? Or it all comes on you now. Okay, so I've given you the awareness of ergonomics. It's now your part too, how you gonna bring it along with your daily life, right? So I hope I'm on the right timing, right? All right, so we have come to the end, and I believe you got the Q&A sessions, right? So thank you all. Since I am unable to see your faces, I'm not sure you guys are listening or getting bored. Am I going too fast or slow? As I mentioned, all this while I'll be giving the presentation and training for real world, not to the students, right? So I thought I don't want to be boring like normal lectures. Hopefully you guys enjoyed. Thank you. We might see another day. So dear host, can we continue with the Q&A?
Thank you so much, Mr. Kabiarso, for highly informative session. So the knowledge you share is extremely valuable and beneficial for us as a worker and student as well. Okay, we will now proceed with the question and answer session. So online participant may post your question in the comment section now. Thank you.
Oh, they're gonna post the question, is it? Okay.
Dr. Aliza, got one viewers asking for the question: how do pathology findings such as a tumor grade, tumor receptor status, and HER2 status directly influence treatment decision and prognosis in breast cancer patients? Thank you.
Okay, thank you very much for the question. So basically, as I presented earlier, when we do a pathology report, so among our what we include in the report is grading of the tumors, hormone receptor status, which is very important to guide the clinician whether or not a patient will be beneficial for a hormonal therapy. So in case where a hormonal receptor was positive, so this patient will be benefited for hormonal therapy, and they are going to start the hormonal therapy for the patient. So in other way, those who are positive for hormonal receptor, this patient, they carry a better prognosis in comparison to those who did not express this hormonal receptor. Okay, so when it comes to tumor grade, basically when we report, we have grade 1, 2, and 3. So if the report came back as grade 3, so this tumor again carry a poorer prognosis in comparison to grade 1 and grade 2 tumor. So all this point that we include in our report basically will guide the clinician on to design a treatment for the patient. Yeah, thank you.
Thank you, Doctor.
Thank you, Doctor, for the brief explanation. Got one more question from Ainul Bashira from Facebook Live. From a research perspective, what are the key ergonomic risk factors most commonly associated with work-related musculoskeletal disorder, WMSDS, and how can early ergonomic education help reduce this risk in the long term? I think this question for Mr. Kaviarasu.
Okay, Inul Bashira, good one. All right, so let's see the issues there. Yeah, first, let's say it's about awkward and extreme posture. So, most consistently reported risk factors in research includes sustained bending, twisting, reaching, neck flexation, or rotation, working above shoulder or below knee level. So, the research finding like prolonged exposure to awkward posture increases muscle fatigue, joint loading, and cumulative tissue damage. So let's say it's for repetitive movements, right? Repetitive movements common in assembly work, keyboard and mouse use, packing and sorting tasks. What are the research findings for this? So high repetition with insufficient recovery time significantly increases risk of upper limb work musculoskeletal disorders, especially when combined with force. I'm not sure how many of them using ergonomic mouse as well, right? Let's say for forceful exertion and manual handling, as I mentioned, that's the biggest issue. Forceful exertion, the manual handling, and the grip force. Usually, it includes lifting, like lowering, pushing the trolley, pulling, strong gripping, pinching, like higher force demands increased internal muscle and tendon loading, accelerating your micro trauma. It goes the same way for static. What is static and sustained posture? As I explained just now, prolonged sitting, prolonged standing. Static muscle loading restricts blood flow, leading to muscle fatigue and pain even at low force level. But maybe when I was, now I'm reaching 40 plus already, but when I was in your age, I'll be telling you, no lah, I can be sitting for hours, no problem. I'm going for concert for 4 and 5 hours. That's your age. That's your age. But when it comes, as I mentioned earlier, this is where you need to consider on the sexes, male or female, the age and everything. Like, okay, in your office, like work, very poor workstation and your design, like poor design forces workers to adopt compensatory posture. As I mentioned, you'll see, Allah, normal hand phone far away from our reaching. What's the big issue? But it increases cumulative exposure to ergonomic stressors. Right? Okay, for I'll give you one work organization factors I mentioned earlier, like high work pace, when during your final year project, inadequate rest breaks, long working hours, and lack of task variation in the office, right? All the time you will be keying in the notes. So organizational factors amplify physical risk factors and also reduce recovery, increasing in the musculoskeletal prevalence. Like your question also about the early ergonomic education, right? Yes. See, build early risk awareness. Early economic education actually helps individuals like recognizing the hazardous posture and movement when they are doing. They can understand why certain tasks cause pain or injury. Like going back home after class, why I'm being lower back? Oh, I'm not doing my exercises correctly. No, that was because of prolonged sitting in the classroom, right? And encourage safer work behavior from the starting itself. So the education actually promotes to correct posture habits. So earlier itself, okay, if I'm lifting something heavier, this is the posture I need to do. As I mentioned, this is to avoid, not after you're having the problem. Proper manual handling techniques. Okay, this is a huge weight for me. I cannot handle. You call up your buddy, ask them to help with you. Regular micro breaks for lecturing as well, right? Well, my lecturers, I still remember, majority of the time, those days will be standing for the whole hours of classrooms, right? But nowadays, if it's online classes easy for you, but still online classes also you'll be sitting for hours. You need to have your body posture to maintain. Research insight like the habits formed early in training are more likely to persist into professional practice. So it will be a normal practice for you guys. Then also support early reporting and intervention. So the workers especially like less aware of this. When people understand economics, they are more likely to report discomfort early, seek adjustment before injury becomes chronic. When you are in a chronic pain, remember, I always tell you, I'm not saying don't be honest with your employer or what you are doing, but whenever there's injury in you, who gonna suffer? It comes from your eye. So this all prevents progressions from discomfort, injury to disability. So end of the day, you the one gonna face it. Got in term of early education, like creates future professionalisms who advocate for economics. As I mentioned earlier, to be honest, this is not to say very rich incoming earning professionalism, right? But it's the awareness, it's my happiness to educate the individuals so that they become they change agents in their organization. You know how many of the workers are struggling on everyday basis, you know, like, okay, that's local. How about foreigners? Most of us are thinking like, alah, foreigners guys lah, they are human beings as well. They got their family. After years of working here, they need to go back them to be with their family and their kid. But the awareness starts here. So supporters of ergonomic risk assessment can like contributors to healthier work system. All right, so there's a lot more actually, but I don't want to take your time. So carry on. I hope it answers
Thank you,
Inol
sir. Thank
Bashira.
you for explanation. Thank you.
All right, thank you very much. It seems that the participants really engaging with both talk from the expert. Then before I proceed, I would like to soft reminder to all participants to scan the link provided in the comment to for registration and insert purpose. Yeah, scan the QR code provided. Okay. Okay, ladies and gentlemen, very valuable discussion. You can see really the participants really interested to know about the talk. and understand well both about the breast cancer and ergonomic topic. And now we move on to oral presentation session by selected students from Bachelor of Biomedical Science and Bachelor of Occupational Safety and Health. First, we invite Ms. Lau Siu In, our Bachelor of Biomedical Science student, to present with title, The Concordance Rate of Frozen Section with Final Histopathology Interpretation in Hospital Putrajaya.
QMC, a very good day and salam sejahtera to everyone. Today, I'm a student from Bachelor of Biomedical Science and my supervisor is Dr. Munira binti Mokhtar. Today, I will be presenting my final year project entitled The Concordant Rates of Frozen Section with Final Histopathology Interpretation in Hospital Putrajaya. So what is frozen section? Frozen section is a rapid tool to provide a faster diagnosis to guide the surgical decision. And the frozen section report will be tallied with the final histopathology report to tally the report, whether it is discordant or concordance. So there might be discrepancy happen. So according to the Ahmed and Zakro 2022, frozen section examination is an important intraoperative diagnostic tool that provide rapid pathological information to guide immediate surgical decision making, especially in the surgery, because during the frozen section, the patient is on the surgery table with cut open. The discrepancies between frozen section diagnosis and final histopathological interpretation may occur with false negative result. It is begin the most concerning issue. Therefore, this study aims to assess the false negative rates of frozen section diagnosis at Hospital Putrajaya by comparing frozen section finding with the final histopathology result over a defined period. In this research, the problem statement is mostly concerning for the false negative frozen section result, because this may lead to a lot of consequences and complications. Firstly, it's about the inadequate resection of tumor removal. Because of the wrong report, so the tumor is not removed properly, and this may cause the delayed treatment for the patient. And probably the patient have to proceed with another surgery. And for the frozen section, there is very limited local data, and there is no institutional audit for the frozen section report. Therefore, the needs for an internal evaluation of frozen section regarding to the accuracy and reliability is very important in this research. We move on to the objective. The general objective is to evaluate diagnostic performance of frozen section by comparing with final histopathology. So for the specific objective, firstly is to determine the outcome of frozen section diagnosis from 2023 until 2024 in Hospital Putrajaya. Second is to analyze the concordant rate between the frozen section and H&E report by measuring the accuracy, specificity, sensitivity false negative and false positive red. So we move on to the study design and method. So for this study, it is a retrospective study based on the data in the LIS system. And the frozen section, all the frozen section cases is done in the Hospital Putrajaya. The periods of data collection is from 2023 until 2024. So the total cases of this among 2 years is 140 cases. I obtained the data for the analysis. The result obtained were classified into 4 categories, which is true positive, the presence of tumor correctly diagnosed. Number 2, true negative, the absence of tumor correctly diagnosed. Number 3 is the false positive, which is frozen section inaccurately diagnosed as a tumor. Number 4, false negative. Frozen section failed to diagnose as a tumor. So based on this classification, the diagnosis performance indicator such as accuracy, sensitivity, specificity, false negative and false positive red were calculated, and statistically analysis was performed by using SPSS software. So this is the result of frozen section from 2023 until 2024. So the comparison between the frozen section and the final histopathology diagnosis. So as you can see, the majority of the frozen section is benign. The frozen section has 85.7% in the frozen section report, but when it comes to tally with the final histopathology report, there is higher malignancy rate comparing to the frozen section report, so which is 17.9%. So there is some false positive rate has been detected. So according to the diagnostic performance, overall there is 19 cases of true positive, 114 cases of true negative. There is no false positive, and there is 6 false negative cases detected among the 139 cases. The overall concordant rate is 95.7%. The sensitivity is 76%, and the specificity is 100%. We move to the discussion. So comparison frozen section with the final pathology report. The final pathology report shows the higher malignancy rate, which is 17.9%. Some malignancy were missed out during the frozen section because of false negative report. Why will this happen? Because the frozen section have lots of limitations, such as small tumor and the low quality of morphology, including the freezing artifact, because the frozen section is using the rapid freezing method. So for the concordant and diagnostic performance, overall the accuracy is 95.7%, which is a high agreement. And the specificity is 100%. Because there is no false positive detected, and frozen section is highly reliable when diagnosing diagnosing the malignancy. A positive frozen section result can be confidently used for intraoperative decision making. So for the sensitivity and false negative finding, the sensitivity is only 76%. So it's categorized as the moderate detection rate because there is false negative rate, which is 4.3% for 6 cases. Likely cause is because of the lymph nodes micrometastasis. It is hard to detect, and the limited tissue sampling is mostly small, and the time constraint during the surgery because the surgery is on the ongoing, and they need the frozen section report for the decision making. So for negative frozen sections report should be interpreted with caution. The final histopathology report remains the gold standard, especially when the frozen section is negative. So we move on to the limitation of the frozen section. So number one is about the sampling limitation. Because during the frozen section, the surgeon will dissect a little bit of sample biopsy for frozen section, and we have to keep some tissue for the final for the H&E report. And secondly, it's about the low quality morphology resolution comparing to the H&E report because it is direct processing from the fresh tissue without fixing with formalin. So the morphology will be very poor comparing to the H&E report. And number three, mostly the false negative cases detected is in the sentinel lymph node biopsy, which is the micrometastasis that is very, very small and very, very hard to detect. So when it comes to the clinical artifact, there is a lot of, because it's using the freezing method, so there will be the eye crystal inside during the processing in the slide. So number 5 is the limitation is about the intraoperative time pressure. Because the timing is quite tight, the surgeon because we need to release the report within 1 hour for the frozen section. So it's quite time pressure. And lastly, the limitation is, this one is the retrospective data. So this will have a lot of limitation because this one is the data from 2023 until 2024. So for the conclusion, frozen section examination is highly accurate and valuable intraoperative diagnostic tool to ruling in malignancy in Hospital Putrajaya, which is 95.7% accuracy. And the final histopathology report remains as the gold standard in frozen section, as it can detect the false negative cases. Okay, that's all from me. Thank you for your attention, and questions are welcome. Thank you.
Yeah, thank you, Ms. Lau, so for sharing your research presentation with us. So next, we will invite Ms. Vishalini Muniswaran from Bachelor Degree in Occupational Safety and Health to present about her research title, relationship between job satisfaction with depression, anxiety, and stress among teacher in secondary government school Raja Mahadi, Klang, Selangor.
Hi everyone, I'm Vishalini Viswaran. So today I will presenting my thesis entitled Relationship between Job Satisfaction with Depression, Anxiety and Stress Among Teachers in Secondary Government School, Raja Mahadi Klang Selangor. So my supervisor is Sir Nordin and my co-supervisor is Madam Fauzana. So today I will cover introduction, problem statement, objective, research methodology, result, discussion, and conclusion, along with acknowledgement and references. So first of all, for introduction, it's all about the definitions. So first is job satisfaction. Job satisfaction is a characterized in the term of effect, although it stems from both cognitive and effective response to the work by Sari and Judge 2004. Next is depression. Depression is a prevalent and serious mood disorder characterized by persistent feeling of sadness and hopelessness by American Psychiatric Association APA 2013. Next is anxiety. So, according to Barlow 2002, anxiety is an uncontrollable, diffuse, unpleasant, and persistent state of negative affect characterized by apprehensive anticipation of future danger that is unpredictable and unavoidable. So, next is stress. So, stress is described by the World Health Organization WHO as a condition of anxiety or mental tension resulting from a challenging situation. So, lastly, is teachers. So, teachers face excessive workload and including lesson planning, student performance evaluation, co-curriculum responsibilities, and the pressure from motivating the student. Factors such as a work overload, disruptive student behavior, and conflict intensity of stress. Negative psychological work environment and financial are major contribute to the depression. So next is my this is my problem statement. So my first problem statement is from statistic of Ministry of Education Malaysia 2017. Psychological and Counseling Division underscore a concerning threat from teacher stress with 4.4 percentage or 2,123 out of 48,258 teachers experience high level of stress due to various factors, which is include job satisfaction, family issue, and finance. So my next problem statement is teacher endure excessive pressure from multiple, include student, parent, education institution, management system, can leading to a confusion and susceptibility to anxiety. Factors such as work overload, disruptive student behavior, and conflict intensity of stress, negative psychological work environment, and lastly, financial are major contribute to the depression. Next is my objectives. So I have three main objectives of my study. So first objective is to measure job satisfaction scoring level among teachers in SMK Rajamali Klang Selangor. So next, my second objective is to calculate the depression, anxiety, and stress scoring level among teachers in SMK Raja Mahadi. So my last and most important objective is to identify the relationship between job satisfaction with depression, anxiety, and stress among teachers in secondary government school Raja Mahadi Klang Selangor. So next is research methodology. So I choose a purposive sampling method, which is include inclusion criteria and exclusion criteria. For inclusion criteria, permanent teacher and the age range between 23 to 55 years are eligible to participate in my research, which include both male and female. So for exclusion criteria, teacher who have a mental illness such as depression, stress, anxiety, even a pregnant teacher cannot participate in my research. So before I collecting the data, the ethical approval was obtained from the ethical committee. So after that, the permission letter by my supervisor was issued to the school management. So after I getting a proper and official permission from the school, I start to collecting the data. So for job satisfaction, I use a validate instrument, which is job satisfaction survey. For objective 1, descriptive data analysis. For depression, anxiety, and stress, I use depression, anxiety, and stress scale, that's 21, and generalized anxiety disorder, which is got 2. For objective 2, descriptive data analysis. So for my objective 3, I use a Spearman Row Correlation Test, SPSS version 27, to analyze the relationship between job satisfaction with depression, anxiety, and stress among teachers. So this is my result. For my objective 1, the figure 1 shows the job satisfaction survey scoring level. So as you can see in the result, 60% of teachers have ambivalent job satisfaction, which means they are not too satisfied and not too less satisfied. It's on middle. So just 40% only they feel satisfied with their job. So my next result is for objective 2. Figure 2 shows the depression, anxiety, and stress scores, which is test 21 and GUT 2. So as you can see in the result, most of the teacher having a normal level of depression, anxiety, and stress, but some of them may feel mild, moderate, severe, and extreme severe of depression, anxiety, and stress scoring level for DUS 21. GUT 20, GUT 2 scoring also same as DUS 21. They had 86.25% having a normal level of anxiety disorder, but 13.75% having a anxiety disorder and need medical attention. So this is my objective 3 result. So table 1.0 shows the relationship between job satisfaction with depression, anxiety, and stress among teachers. So as you can see in the table, the depression R value is minus 0.644 and P value is 0.000. Anxiety R value is minus 0.466 and P value is same as depression. Stress R value is minus 0.558 and P value is same as depression and anxiety. And GUT2 is little bit different from DUS 21. So GUT2 R value is 0 -0.329 and P value is 0.003. So my result indicate that there is a significant relationship between job satisfaction with depression, anxiety, and stress. And this is my discussion. So although most teachers reported moderate job satisfaction with work overload, administrative demand, and limited reward, may explain why some experience psychological symptoms. Supportive supervision and positive work relationship appear to buffer their stress, but unsolved organizational issue can continue to affect their mental well-being, indicate a need for improvement in school management system. Next is this finding suggests that while the majority of teachers are able to manage their mental health effectively, but a vulnerable subgroup experience psychological strain. So lastly, these findings are consistent with the previous study by Noor Faiza Ali and Q et al. And Strauss all reported a significant association between job satisfaction with stress, anxiety, depression, and even burnout. So, this study confirmed that improving job satisfaction and reducing work related stress, depression, and anxiety are essential to strategy for promoting teachers' well being. So lastly, my conclusion. So my conclusion is the result shows a significant relationship between job satisfaction with depression, anxiety, and stress among teachers, highlighting the job satisfaction as an important factor that influencing the teacher's mental well-being. This result empathize that the need for intervention aim at improving job satisfaction to promote better psychological well-being among teachers, such as workload distribution and supportive system at the school, and even they can do some mental health counseling. So, lastly, acknowledgement. So, I will like to express my sincere gratitude to my supervisor and co supervisor for their invaluable guidance and support throughout my research study. And I am also deeply appreciative of my family and the SMK Rajamadi school management and all individuals who contributed to this research for their encouragement, cooperation, and valuable insight providing during the course of this study. So this is my references from the previous study, and thank you for listening to my presentation. Thank you.
Thank you, Ms. Vishalini, for your insightful sharing.
Okay, we will now open the floor for a short question and answer session. Online participants may post your question in the comment section. And okay, we got one question for Miss Lau Xue Ying from Facebook, Natalie Allen. Why did you use the final histopathology as the gold standard in the study?
Because the H&E stand for the final histopathology report, it is it provides the better tissue preservation and higher morphology resolution. So it will be very clear under the H&E report. So this will tally back with the frozen section. So can make it clear. So can tally with the report. That's my answer. Thank you.
Thank you, Ms. Lau Xue Ying. And also we got one question for panel Visha. What challenges did you encounter during the data collection process?
Okay, the toughest part is to approach the teacher is quite difficult because they have too much work and some of them really hesitate to do the research. But it took almost 2 months to finish my data collection actually. So this is the most challenging part of the research. So thank you. That's all.
Okay, with that, thank you once again, Ms. Vishalini Muniswaran and Ms. Lau Siu Ing. Okay, ladies and gentlemen, this is bring us to end of the 20th Undergraduate Colloquium on Health Science 2026.
We hope you enjoyed the insightful presentation On behalf of the organizing committee, we thank all the speakers, generous sponsor, KT Dynamic Sendirian Berhad. We extend our deepest gratitude to all distinguished guests for their available contribution and to all participants for your involvement and support to UCHS 2026.
Before that, we kindly request to all participants to access the link provided in chat box for registration and e-certificate purpose. So we hope that knowledge we share today will be beneficial for your future endeavors in clinical research. Thank you, everyone.
Thank you and have a pleasant day.
Di sini keilmuan jadi budaya, kepakaran sendi kerjaya, ilmu dihayati sepanjang usia, amal jariah tunjang jasa, dipayungi langit tanpa sempada, bumi subur jaru esa, disinari surya, alam Tuhan yang esa, dibuai bayu ilmu peradaban. UNICEF kala sinar bestari, pancaran ilmu serta amali, pengisi minda pengasuh budi, pelopor utama insan misali. Kau umpama pohon nan rimbun, tumbuh subur teguh beruntun, jati diri hidup berukun, tahan uji turun temurun. UNICEF kala sinar bestari, pancaran ilmu serta amali, pengisi minda pengasuh budi, pelopor utama